and city staff as authorized under Minnesota Statute Section 13D.021 due to the declared local public health emergency. At this time, I will ask the clerk to call the roll so we can verify a quorum for this meeting.
Councilmember Gordon? Cano?
Here.
Ellison? Palmisano?
Present.
Fletcher?
Here.
Chair Cunningham?
Present.
There are 4 members present.
Thank you, Madam Clerk. I know that Councilmember Ellison is not feeling well today, so sending him well wishes. Colleagues, we have 10 items on today's agenda. If there's no objection, I'm going to take the agenda slightly out of order, and we will begin with the last item on the agenda, which is item number 10, our monthly update from the Health Department on COVID-19. I'll invite our Health Commissioner, Gretchen Musicant, to give that report. Welcome, Commissioner.
Thank you, Councilmember Cunningham. I hope that there I am, there's my slide. I'm going to give you a quick update, about 10-minute update since our last report to you, which was a month ago. And so if I report changes, unless I say otherwise, it's a change from my last report a month ago. So next slide, please. So to date, we have over 14,000 confirmed cases in Minneapolis, which is a 28% increase over last month. And we have seen really a growth even within the last month. 2/3 of those cases were diagnosed after October 15th. And we're seeing this increase across ages, racial and ethnic groups, and it's due to community spread. With that increase in cases also comes an increase in hospitalizations and the use of ICU within hospitals, and that has doubled over the last week. Unfortunately, there have been 264 people in Minneapolis who have died because of COVID, representing an additional 16 deaths since we last had this report. And most of them, 84%, are among people 65 years of age or older. Next slide, please. So this graphic shows you the blue line is Minneapolis and the orange line is the state of Minnesota. And recently we have had a rate that is not as high as the state, but you will see that we are now with the state in the red zone. And really only were briefly in the red zone back in the spring. And so there's no curving of that line. It's going straight up. And so this is a very concerning place to be. The red zone is considered a tipping point, a place where we might indicate the need for more stringent safety measures. And it certainly increases our need to be more creative in our communication. And I do understand that the state is considering what steps are appropriate to take at the statewide level as well. Next slide, please. So we are able to look, not publish, but look at the positivity rate by zip code. And so as we look across the city, we see that most of Minneapolis zip codes have a positivity rate above 5%, and 5% is a level that had been set on the state dashboard. We hope to stay below a 5% positivity rate. The state 7-day average is 9% and climbing. So lots more testing going on, but a lot more positive people or people finding that they are positive for COVID-19 as well. And as the numbers increase in our community, contact tracing, while we're still doing it, is much more challenging and less effective because there are just so many cases and people don't always know where they have gotten the case from. We have dedicated part of our staff now to following up with contact tracing in higher risk settings in schools and workplaces so that we can be more efficient in notifying those who might have been exposed because of being together with someone with a case in one of those settings. Next, please. So one of the things that's been on our mind for a while now has been the CARES funding, and it's been really a boost to our activities, but it also comes with some limitations. And so the requirement is that we spend it by November 15th. And as we know, if you think about that chart I just showed you, we're not at the end of the outbreak, but we are at the end of the CARES funding. And so we have to expend the money by the 15th. If we're purchasing something, it has to be expected that we would use what we are purchasing within 60 days. So just a rundown of how we have used some of the money allocated to the health department. We have been able to use about $4.5 million. We have used about $400,000 of that to support community testing events. We are purchasing saliva testing kits, 20,000 of them, that we will make available in a variety of scenarios for the next 60 days, and that's for $2.1 million. We also just this week actually completed review of applications and are spending $1 million to support community food security, and we hope that that's an investment not only for today, but that will help us support food security into those 60 days. We have used about $300,000 of that for case investigation and contact tracing, both for the AmeriCorps folks that we are using and also some of the internal staff in the enterprise that are helping us out. We are purchasing personal protective equipment and supplies both for the city and staff, but also the community, and we have to date spent about $340,000 and are placing some final orders for a bit more. And then finally, we're preparing for mass COVID vaccinations. And so we have spent about $170,000 both for community engagement and also ordering cold storage and other supplies that we think will be needed as the vaccine becomes available. And here we are with the food security. Just wanted to tell you a little bit more about this. So we were able to allocate $970,000 of CARES funding to 37 community nonprofits, and they're using that funding to purchase food and hygiene products and also food distribution supplies and equipment. And the awards range from like $2,000 awards to $53,000 awards, paying for a variety of needs. And we prioritize organizations that are serving the communities with most need. And some of the targeted special populations, in addition to a real attention to BIPOC communities, are those who are serving folks who are HIV/AIDS positive, older adults, and persons experiencing homelessness. Additionally, there's another $30,000 that is allocated to food distribution that will now be in the Corcoran Park that had previously been in the Powderhorn Park, and that is something that we've been helping to support since the murder of George Floyd. As we look forward to vaccine distribution, we know that there's going to be 3 identified phases of distributing vaccine once it's available. The first phase will go to hospital and long-term care facility staff, and sort of a phase 1B, if you will go to first responders and others in that category. Phase 2 will be high-risk populations such as seniors and essential workers, and then phase 3 will be availability for the general public. And we expect the first doses to come in mid to late December. The federal government will determine how much comes to Minnesota. The state will determine how much comes to the local level. Next, please. And this is a graph, just kind of let's be prepared for some bumps in the road graphic. And so even as we get that first vaccine, it's not going to be a lot of vaccine that's available. And so even while we're in phase 1, we may have a lag of a few weeks to have enough to finish phase 1. But then by the time we get to phase 2, which is the at-risk populations, we should be in pretty good supply territory. We are the Metro Regional Healthcare Coalition is the lead on vaccinating hospital staff. And then at the local level, local public health is working with the state health department to determine how to reach all of the long-term care facility staff. And just one last comment on that graph. It's a point in time. And certainly the things that we're discovering about vaccine, even the companies that are going to be supplying the vaccine, continues to evolve and change. And so this is good for today, but it may be changing in the future. Thank you. So part of what we're thinking about is really how do we engage the community to be ready for the availability of vaccines, so they'll take advantage of an opportunity that's placed before them to stay healthy. And so we have been starting that by sharing information, gathering insights and questions on vaccine from the community. We've done that a couple of ways. One is to host larger presentations and listening sessions, even on the radio and with community groups and neighborhoods. And we're following that up with recruiting and training some vaccine community liaisons, building on work we did earlier in the outbreak with our Shared Power Advisory Committee. And some of those members will be helping us, as well as some newly recruited folks. Some of the things that we've heard in the community have been questions about the interaction of the vaccine with the seasonal flu shot. And we do understand that there will be some guidance about trying to create a space of time between when you get a flu shot and when you get a vaccine for COVID. And we'll learn more about that as we go. Other questions had to do with the distribution process and the timing, and I've just shared with you what we know so far. And that's part of our approach with the community, is to learn together, and we hope that that will benefit both of us at the same time. So we have been diligently working on expanding the testing availability in our community, and with the CARES dollars, we've been able to have 20 community testing events that were led by the health department. 2 more are planned before the 15th of November, one this Saturday and then one on the 14th of November. We've also supported numerous state and county-led events, and in total, all of those have served about 5,000. We've done testing for 5,000 folks. We've also delivered almost 800 flu shots as part of that effort. As winter comes, we're evaluating what kind of indoor options there are, and the purchase of saliva tests was part of our approach to winter, because there's a number of ways you can deliver it that might not require so much intensive interaction inside. And then we have just heard that the state is opening on Monday a daily testing site at our own convention center using saliva tests. And that will operate 7 days a week. Weekdays will be noon to 7, and weekends will be 10 to 4. And so we really think that that is going to add really an important additional capacity for people who live and work in Minneapolis. So just wanted to share with you some feedback we got from a testing event we had at Shiloh Temple, just to let you glimpse into how people are receiving the work that we're doing on behalf of the city. Your team was a pleasure to work with. Also, your commitment to the health of North Minneapolis communities is unwavering. Because of you, people of color and all those who call Minneapolis home can thrive and be healthy in this great city. So that wonderful affirmation of the work that we're doing in the community on your behalf. As we look out into the future, we are very concerned about the ending of the CARES funding and what that means for financial support for meeting the needs that will be coming up after November 15th. We have made sure that the state funding that we received early in the outbreak, some of that is remaining, and we are able to spend that through February of 2021, so we're grateful for that. We will probably need more funds for contact tracing and communication, just as we continue to share with people the information about the vaccine, to respond to the changes in the outbreak. So communications is an important investment. And then we know that community well-being and resilience is hard for us all to maintain in this very, very long outbreak. I did hear yesterday that some federal funds have come to the state, and the state will be sharing it with the local level to support vaccine planning and administration. And so we don't know when exactly that's coming. We don't know how much we'll have, but we do think it will be soon. And that's the end of my summary report.
Thank you, Commissioner. Do my colleagues have any questions or comments related to this presentation? Councilmember Fletcher.
Thank you, Chair Cunningham. There were some reports about shortages of beds and shortages of workers to staff ICU facilities. How dire is that? What's the status currently on availability of hospital beds in Minneapolis?
Yes, thank you, Councilmember Fletcher and Chair Cunningham. Yes, this is a shortage that has just emerged, just as the use of ICU beds and hospitalizations have increased just most recently. And we have a regular check-in with Dr. Hick from HCMC, who is also in charge of statewide efforts to make sure hospital capacity is sufficient. I think it may get to the point where some less than urgent procedures need to be delayed so that we can see that staff are redirected from some units and hospitals to other parts. I have also, the metro region is really good at sharing and thinking together as a whole amongst the hospitals, and so we can be really grateful for that. I know with the outbreak across the state, there has been more interaction between hospitals across the state and the metro area. In fact, I heard that it was necessary to move some folks from the metro area to regional centers in the state just because of that very shortage. So yes, we're reaching a point where we need to start using some of the strategies that maybe were in the planning book that we didn't have to use yet, but it's very significant issue right now.
Thank you. And then it felt like kind of a news-making piece of information that we're expecting a vaccine in mid-December. How concrete is that? How sort of well known is that? I hadn't heard that, so I guess I'm curious about how solid that is and how much people can start making plans around the phasing that you described.
Councilmember Fletcher, Chair Cunningham, I think that's a planning guide at this point. When it comes to actual having approval and supply, I think we'll probably have like a 3-week notice that, okay, now that chart that I showed you is ready to begin. And so that's our best guess right now, and we'll just wait for some confirmation to make sure that the testing of the vaccine is all sound and good, and we're ready for the phase of distributing the vaccine. There is one company that's on a trajectory to reach this timeline, There's another company that's doing quite well that might follow closely thereafter. So, yeah, those are the things we know.
Thank you.
Thank you for that. I'm curious as well, thinking about the vaccine. Is it expected to be available for free, or will there be a cost associated with it, or is it way too soon to be able to know that yet?
Chair Cunningham, I feel like I have an answer for that, but I don't feel 100% confident.
That's fair.
I believe I have heard that the vaccine itself might be free, but then there's all that goes with it, and paying staff to administer it and finding the funding for that. That's what I believe I know.
Yes, that part's not free. Absolutely. And I just had a follow-up question because I'm very concerned about us being in the red zone, and the consequences of that. So 2 questions related to that. Are there recommendations? Are there recommendations for us to be able to address this locally? And what can we do as elected officials, and maybe the public watching? How can we communicate with the folks around us, our constituents, our neighbors, as to how do we slow this down?
Thank you for that question, Chair Cunningham. I don't have a list of things that we can do as regulators necessarily at the local level that I think will be highly impactful. There are a few things that we have forwarded up to the state that we think might have some contribution. One idea I heard was just to think about a finite amount of time, like 2 weeks. Like let's spend the next 2 weeks really social distance, physical distancing, wearing our masks, remembering to wash our hands, which we kind of got lazy about maybe. In the interest of hospitals, in the interest of people in nursing homes, in the interest of our kids who want to go back to school, let's see what an intensive 2-week period would be. And so maybe creating some kind of a challenge for ourselves might be a communication approach, but I think it might also prove to be somewhat effective.
That's great. Thank you for that. Are there any other questions or comments from my colleagues? All right, seeing none, thank you so much, Commissioner, for that monthly update. It's been great to be able to create this space for us to dig into this a little bit more. So thank you for your expertise. Please pass the gratitude along to your hardworking staff who are doing all that they can to make sure that our city is healthy. So thank you.
Thank you for this opportunity.
Of course. Seeing no further discussion, I will direct the clerk to file that report. With that, we will proceed back to item 1 on the agenda, which is a public hearing on the Neighborhoods 2020 plan. We will begin with a staff presentation, which I believe will be introduced by the Director of Neighborhood and Community Relations, David Rubador. Mr. Rubador, are you on the line and ready to go?
I am. Can you hear me?
Sure can. Welcome. The floor is yours.
All right. Thank you very much. Thank you, Chair Cunningham, and good afternoon, committee members. I'm David Rubador. I'm the Director of the Neighborhood and Community Relations Department and with the City of Minneapolis. And I'm joined today by Steve Gallagher, who's our Policy Specialist at NCR, as well as C. Terrence Anderson, who is with the University of Minnesota Center for Urban and Regional Affairs. Both of them will be joining me in this presentation. Today, we're here to present the final recommendations for the Neighborhoods 2020 program. We're excited to be bringing these to you, these recommendations to you today, as they reflect years worth of work that we have been doing with neighborhood organizations, community organizations, residents, elected officials, city leadership, as well as staff. For the presentation today, I'm going to kick it off with doing some context setting and going through some of the background information as what's led us to today. Mr. Anderson will be reviewing the work that Kira has completed, and then after that, Mr. Gallagher will go over the program components. I do want to note that Mr. Anderson is participating via phone because we had some technical issues getting him connected, so apologize in advance if there happens to be any slight delay in communicating with him. Next slide. So one of the things over the last 18 months, this work has been guided by what's been called the Neighborhoods 2020 Steering Committee. This committee was established by the council back in May of 2019. I'm kind of refreshing everybody's memory. It's been 18 months since we really revisited this visited this with the council. The steering committee has been guiding a lot of this work. It's been chaired by Councilmember Cunningham and also our city's budget director, Micah Intermill. It's also had representation from other council members, Council Vice President Andrea Jenkins, Council Member Andrew Johnson, City Coordinator, the city's attorney's office, the mayor's office has had representation. Kara's been part of it, Finance Department, as well as NCR being part of this. The committee's actually added a lot of significant capacity to the development of the guidelines and added a lot of value into these conversations. And I have to say, just on a personal note, that I have found working with this group of people to be very powerful and very informative. And I want to thank all the committee members for their contribution. They've been working 18 months on putting these recommendations together. The steering committee also reflects a different approach. It's really looking at our neighborhood organizations and how we as an enterprise support them from a broader citywide perspective and bringing in more disciplines than just the NCR department into these conversations. Next slide. Before the council today, there's a set of actions that we're requesting. The first of which has multiple components, is to recommend authorization of the Neighborhoods 2020 program guidelines and funding formula. In that, there's a couple sub pieces. The first of which is to extend the current community participation program contracts for 6 months to July 1st of 2021. The purpose behind this is to really allow a little bit more of a smoother transition, give us a little bit more time and neighborhoods more time to get us up and running, and also to be able to incorporate the new census data, which should be arriving sometime in April. Second piece is to authorize recognition of neighborhood organizations through the end of 2021. The new program actually has kind of an authorization component to it. And again, to help smooth the transition into the new program, just give a blanket provisional recognition of neighborhoods organization recognition status through the end of next year to get us and the neighborhoods working together on putting the program into place. A third component is adding some additional language just to clarify the benefits of being a recognized neighborhood organization with the city of Minneapolis. This isn't really a substantive change, but it is a clarification change for the program. Next slide. And the last piece, which I'll talk about more at the end of the presentation, but authorizing the continuation of the Neighborhoods 2020 Steering Committee to review the programmatic and legislative adjustments to the neighborhood revitalization program for the purposes of achieving our equity goals and creating greater flexibility for neighborhoods. And again, I'll talk about more about this at the end of the presentation. Next slide. So the steering committee is bringing the recommendations forward in two pieces. These are some major changes, both with how neighborhood organizations will operate, but also even how the city will be supporting that work. And in order to help kind of dissect this down into kind of manageable pieces for discussion, the steering committee is bringing this forward in two pieces. The first of which is what's before you today for the Public Health and Safety Committee. Really looking at and reviewing and approving the program guidelines, the policy behind it, and the funding formula. Your recommendation today will then be forwarded to the full city council to be discussed Friday, November 13th, so a week from tomorrow. The conversation around the total amount of funding that's being put into the program, which currently in the mayor's budget is proposed at $4.1 million for 2021, and also the base level of funding. Oh, if we can back up a slide, please. And also for the base level of funding for neighborhood organizations, that would go through the regular city budget process. So I'll be presenting the NCR budget to the budget committee on November 12th, and in that discussion presenting the mayor's recommended $4.1 million funding for the program, as well as introducing the base level funding discussion. I want to make a note to the public that the November 12th meeting is not a public hearing. It's a presentation by the department to the budget committee, and that the city budget process has multiple opportunities for people to be able to comment and make and participate in public hearings. The public can find that on the city's website, as well as NCR will continue to send out updates to our Neighborhoods 2020 list to inform people about upcoming budget conversations. Next slide. As I mentioned at the beginning, the City Council looked at this and passed a number of steps back in May of 2019. I just wanted to refresh people's memory to put this into context. There was a staff directive that was passed in May of 2019 that was actually rather lengthy. This is not the entire staff directive, but really kind of highlighting the major components of it. This really set forth the work that has led us to today. The staff directive, in summary, approved a Neighborhoods 2020 framework, kind of a general guideline of what this program should look like. They directed the development of guidelines to be consistent with the framework, as well as keeping the program budget neutral and within the $4.1 million budget. It established or directed the completion of a racial equity analysis, as well as it's the directive that actually put the steering committee into place. What comes before you today is largely reflective of the adopted framework that was back in May of 2019. I do want to point out there is one significant change coming from the steering committee in recommendation. Based on the results of the racial equity analysis conducted by CURA, the steering committee is recommending that the base level funding for neighborhood organizations be reduced from an ongoing level of $25,000 to a phased-in level of $10,000 over 4 years, and that those additional funds that are saved as a result of that be put into what's called the Equitable Engagement Fund, which Steve will talk about later. The idea here was to put more of an emphasis into the funds that are more specifically designed and directed by the racial equity formula that's included in the program. That's as I mentioned earlier, that discussion is intended to be had through the city's budget process, which will start on November 12th, or start for this program on November 12th. The recommendation of this different funding level for the ongoing base funding was included in the guidelines that were sent out for public comment and has been publicly released for many months now. Next slide. A little more context setting, just a little bit why we are here and why are we doing this. Neighborhoods 2020 is a recommendation for the city's future programming and funding for our neighborhood organizations. Neighborhoods are funded currently through the Neighborhood Revitalization Program, as well as the Community Participation Program, otherwise known as CPP. The Community Participation Program actually ends this year in less than 2 months, and a new program is needed to move forward. The service model for our neighborhood organizations has largely remained unchanged for 30 years, all the while that our city goals, demographics, and residents have changed dramatically. Our city is more diverse and renters make up a majority of residents, and we are much more aware of the equity issues facing our community. Next slide. Through this work, the steering committee has kept equity as a core value of our work, and we believe that the guidelines being brought to you today reflect the goal included in the adopted Minneapolis 2040 plan, where Minneapolis will have an equitable civic participation system that enfranchises everyone, recognizes the core and vital services neighborhood organizations provide to the city of Minneapolis, and builds people's long-term capacity to organize and improve their lives and neighborhoods. Next slide. This is a high-level timeline. There's been many meetings, many conversations, many discussions, many learnings, many engagement sessions since about 2016 when we took on this work. This is just a real high-level summary. I won't go through it in any detail, but just wanted to again help put this into context about what is being brought forward today. Next slide. Just a little more context setting before I hand or move this into the program itself. For the public's purpose, for folks that may not know a whole lot about our neighborhood organizations, Minneapolis has 84 residential neighborhoods that have organized into 70 different independent nonprofit organizations. They are uniquely positioned to identify and act on local needs and priorities, create a sense of place, and give residents agency. They work on such things as community building activity, economic development, and housing, and it is a vibrant system that we have. Next slide. The city has also invested heavily into this work, funding over $300 million over the past 28 years. And neighborhoods really focus a lot of their work on leveraging volunteer hours. And just in between 2016 and 2019, leveraged almost 500,000 volunteer hours in their work. Next slide. 2020, as we all know, has presented many, many challenges, and I did not want to pass up the opportunity to really highlight that in 2020, with the many things that have been facing our city, very serious issues, the global pandemic, the killing of George Floyd, the civil unrest, homelessness, and food insecurity, neighborhoods have really leaned into this work in partnership with the city, and it's been and that they've done a lot of work. So I wanted to point out just a few of the significant contributions that they have worked with the city on over this past year, and those are included on this slide. Next slide. But we also know that not everyone's been fully engaged in this work. The NCR department has been doing a board diversity survey, which started in 2014, that shows that BIPOC and renters are significantly underrepresented at the neighborhood board level, and that the survey, which has been conducted 3 times since 2014, shows that we are not making progress in getting more diversity, more people of color, more renters involved in our neighborhood groups. Having diverse representation at the board level where decisions affecting resource allocation, program development, and staffing decisions are made is really important, and diversity in leadership matters. Next slide. My last slide before I hand it over to C. Terrence, who's going to go over the racial equity analysis, is really just to illustrate the amount of resources that the department provides to neighborhood organizations strictly through funding allocations. As you can see on this slide, in 2019, of all of our community-facing funding, neighborhood organizations received over 95% of the funds that went out from our department. This is important work, no doubt, and it continues to be a funding priority for the city. Building greater inclusion and equity into our programming will be very impactful for our community. So with that, if I can hand it over to Mr. Anderson to go over the racial equity analysis. I'd like to do that at this time.
All right, can folks hear me?
We can.
Okay, there might be just a little bit of feedback, and there's definitely a delay on the video, so sorry if I'm responding back a little bit slower. But going into the next slide, the racial equity analysis representation, just as a reminder, to do a racial equity analysis, Kira was asked by the City of Minneapolis through our contract with NCR to perform a historical racial equity analysis to sort of understand in context that this work is existing in. So we looked back to, we did our own analysis of the data that the city currently had, looking through history, as much as we can tie program outcomes, program analytics to racial outcomes. We looked at all of that data, as well as we looked at a number of reports going back to reports and studies going back to 1991, I believe was the earliest report, studying the NRP program and continuing into the CPP program and then into what we study today. And so really our racial equity analysis is a summation or a broad stroke look at what we reasonably believe racial equity was achieved or not achieved in the context of neighborhood association work. Without going through this all again, because I think we talked about this broadly with the City Council, but just as a reminder to what we found in that, nearly universally from the beginning, renters are very underrepresented on neighborhood association boards. Similarly with Black, Indigenous, and other people of color have been, since the very beginning of this work, very underrepresented on neighborhood association boards. Of course, the more recent data that David just went through from the recent NCR board diversity surveys, you can sort of see that in context. But researchers were finding that very same thing since the very beginning. In fact, my boss at Kira at Getz did a study in 1994 that showcased that boards were a little bit more diverse prior to NRP, right? Boards, neighborhood association organizations existed prior towards the city formalizing a lot of those organizations in the early 1990s. But that really sort of dissipated as those NRP funds remained more available. They sort of became more dominated by white homeowners, business owners, and property owners. So I'm talking about landlords, really became sort of the focal point of who was sitting on these boards. That still more or less carries today to maybe a slightly lesser degree, but really that across the system, that's what we broadly see. Of course, we see some neighborhood associations who have been doing really good work in recent history on diversifying their work, but still plenty that I think would self-admit that there's a lot of work to do, but also know that there's a lot of work to do that going forward. Going to the next slide, which I think should be representation continued, shows that, so one of the things that we found is what neighborhood associations had to do was to ratify or to put forward action plans about what their neighborhood association was going to do with that NRP money. Part of this representation story is about who participates or what percentage of neighborhood organizations or neighborhoods participate in their neighborhood associations work. Sort of historic looks at this. One of these studies from 2005 showed that sometimes less than, or most of the time on average, less than 2% of neighborhood residents attended these meetings with lows of 0.4% and highs of 3.3%. And that's in reference to in the early 1990s through mid and late 1990s, as these neighborhood organizations were formalizing, creating these action plans about how to spend their NRP dollars. Very small percentages of neighborhood residents participated, once again largely dominated by white homeowners, business owners, and property owners, largely sat on those boards across the system. Mainly finding that, of course, the context of a lot of the NRP work was preventing white flight. The city was perhaps described as not the best place. And so NRP was sort of was designed around that time, preventing homeowners from leaving the city, bolstering different neighborhoods from a variety of different perspectives, from a business perspective, from a safety perspective. Parks became focal points. But I think researchers have sort of talked about this. First and foremost, NRP was conceived, if not explicitly, but implicitly, as a program for homeowners and to prevent this sort of that white flight. And, once again, since 1995, researchers find mainly middle income, mainly white homeowners dominated the process. And I think what you might also find is that prior to sort of the NRP process, and certainly within it, there's always these calls to sort of take care of renters, to look into affordable housing and building affordable housing and a lot of different things. Of course, some of that was done, but sort of what one researcher found in 2002, they sort of sardonically described as an outright attack on renters. I think just to bring this up, why was it the case that renters and people of color were underrepresented, right? It just wasn't that folks weren't interested in it, sort of perhaps by design or by outcome of the program. That happened to be the case that that representation was not fully representative of the city of Minneapolis, and as that might continue today among some neighborhoods. Going to the next slide. So really just to shorten all of that conversation, once again, NRP was not designed to be a racial equity program. It was designed around different goals. It did try to address other city characteristic imbalances, right? There was these 3 different characterizations of neighborhoods that allocated money in different ways. But the primary benefactor across the work, I think through NRP, even to today, is white homeowners. And so there's been pushback, and I always ask the question, if not white homeowners, then who was the primary benefactor of this work? So hopefully this isn't a controversial statement, but and perhaps it's not even surprising to most folks who've been very attuned to neighborhood association level work, but just to state it as a fact that it is the case with neighborhood associations that the primary benefactor of this work is white homeowners historically. Thing that's still out there, I think this number may not be accurate today. I'm not sure exactly what's happened in the last couple of months, but when we did this racial equity analysis, there was still a huge amount of NRP dollars that were still out there. At the time, I think 35 million. Some of it contracted, some of it uncontracted. I think maybe the split was around half, but there's still a lot of these legacy dollars and sort of program intentions that are still out there. And so I think that's something to think about in the context of advancing racial equity in this future work. One thing to point out, it's a lot of work to do this neighbor association work. David pointed out the amount of volunteer hours and sort of the dollar amount that it takes to do this, but it's plain to the case that regardless of what these program or what we decide or what the city decides as the program intentions, many neighborhoods do not have the staff capacity to do significant work. So to whatever question we're asking neighborhood associations to do, we just have to recognize what do they have the resources to be able to do. And certainly I'm sure that will be a conversation among the city council. I would say that, you know, when we talk about institutional racism, we sort of talk about this as an abstract thing often, and sort of not naming that it's what are their individuals or what programs are sort of leading to these broader societal trends that we see in the city of Minneapolis. What I just want to point out from this racial equity analysis, I think this is what it looks like, right? If we're getting an underrepresentation of renters and underrepresentation of Black, Brown, and Indigenous folks, right? And if that continues to today, if the primary benefactor was white homeowners, property owners, business owners in history, what else would we call that? And so just bringing that to the forefront, that this is what this looks like. And I think part of what, in discussion with the neighborhoods, residents in neighborhoods, and the city, what we're hoping to overcome or point towards overcoming in the forward program of Neighborhoods 2020. I think that's the end of my slides right there. I think we'll be back in a little bit. Thanks.
Great. Next slide, please. Thank you, Chair Cunningham and members. We built these guidelines from the framework passed in May of 2019. Next slide, please. And these funding programs consist of actually 4 aspects that essentially work with one another. And I'll go through each one of these funding programs next. Next slide, please. The City Neighborhood Network Fund. Its purpose is the continuation of the neighborhood network by supporting base administration funding. This program creates minimum standards for neighborhood organizations, which will ensure membership is open to all residents, ensure equity in decision making, create a sense of place and pride within communities. As part of the Neighborhood Network Fund, there's an official recognition process for neighborhood organizations. These organizations, residents, and the city will all know what the minimum expectations are and what the relationship is between each other. There's also accountability measurements, which help to ensure the minimum standards are in place, but it should be noted that these are pretty much equivalent to most nonprofits in the state of Minnesota. Based on the racial equity analysis by Kira, a recommended change from the steering committee made the policy recommendation for the base funding to be $10,000 after 3 years, and put more of the funding emphasis on the Equitable Engagement Fund. Next slide, please. The Equitable Engagement Fund's purpose is to ensure neighborhood organizations engage all residents in their community. Underrepresented or underengaged residents are informed, connected to their community, and feel represented and heard. This is a significant and key portion of the new programming, which is allocating resources that targets areas in the city which have historically been underserved. Neighborhoods will propose activities that will be reviewed. Some of the criteria for the proposed activities will include the value of neighborhood organization contributions are in proportion to the amount requested. The people who directly benefit from the project are actively involved in its development. There are measurable benefits which are well planned and realistic within the time frame. This program also allows for an innovative approach to a basic need that involves new ways for people to work together. In fact, this program allows new approaches that would not normally be allowed under other funding programs, in which this is a learning program looking for new best practices. Neighborhood organizations should not be afraid to fail in new engagement practices, but rather learn from it and come up with something new and even better. It also should be noted here that staff time, which is dedicated to engagement practices, would qualify as under an expense under this. Next slide, please. At this time, I'd like to bring back C. Terrence to talk about how the equitable engagement funding formula was created. C. Terrence?
Yep, I'm. Hope folks can hear me. So the Equitable Engagement Fund, one of the things that, of course, we're thinking about is not, of course, just digging into history, but sort of like what does it look like to sort of point towards doing racial equity in the future. So the Equitable Engagement Fund, I think, is sort of the response within this programming to do that. Most significantly, talking about how do we sort of allocate funds across the city to do that equitable engagement, to do that engagement among underrepresented populations. So we don't have a slide in here that sort of shows a map, I don't think. But actually, I think it might be the next slide, and I can talk about it then. But the Equitable Engagement Fund is comprised of 3 different characteristics that the fund is sort of looking for. First being areas of concentrated poverty, which was 50% of the allocation. 2 was cost burdened households, that's 30% of the allocation. And the neighborhoods that are experiencing gentrification being the last 20% of the allocation. So I think that sort of the way that we're thinking about creating this fund or creating the formula for this fund was more or less to find those populations of people who have been under engaged historically in the context of neighborhood association work. But even more importantly, too, if we're talking about who are the populations of people or groups of people that should be the benefactors of today's equity work, then that's where these dollars should be allocated most primarily. And so, yes, folks that are in poverty, folks that are sort of at risk of being pushed out of the city in sort of 2 different ways are the focus of the fund. So you can see the sort of the allocation breakdown. I didn't put the math up there, but I can talk about that too, if that would be helpful. But more or less, this is in the most simple way to explain it, was the way that we comprise the formula. Yeah. Oh, and if you go to the next slide, I think it might be a little bit slow on my computer. I believe there will be 2 maps that will show sort of the change. Oh, yep, there we go. Of the different formulas. So on the left, you see the sort of the current formula, the CPP formula. The darker the color shows where the majority of the funds are going today. And then on the right, with including the $10,000, assuming a $10,000 base funding for each neighborhood, the map on the right represents what is being presented today as a result of that equitable funding formula. So a pretty significant shift. Of course, there's been a lot of conversations with a lot of different neighborhoods who this is a pretty marketable change. And if I know the city will be having a conversation about funding as a whole, but just in terms of as it is being presented, you can sort of see the change today, which hopefully maps up with what you think even anecdotally are sort of these neighborhoods that comprise those populations that I just talked about. So, and then I think that is going back to Steve.
Yep, thank you. Next slide. I will talk about the Partnership Fund, which is a uniquely created fund which brings community-based organizations and neighborhoods together in a partnership to engage historically underrepresented residents meaningfully and effective on policies, programs, and projects. This fund was partially created to bring other voices forward through effective engagement and to help community-based organizations and neighborhoods work collectively for a common goal. This should increase the diversity of organizations as well as create a comprehensive engagement system that values all voices within the city. Next slide, please. The Collaboration Fund, or Collaboration and Shared Resources Fund, is available for 2 or more organizations who may want to voluntarily consolidate their organizations and share resources. Realizing that in the long term, funding for 70 neighborhood organizations is a tough endeavor with the amount of funding available. Many organizations, through discussions and meetings, have indicated this is a great need to remain viable long term. Many over the years have already combined to share staff, office space, while some have even managed to fully merge together. Next slide, please. The steering committee is recommending the extension of the current community participation contracts for 6 months. This extension will allow both neighborhoods and the NCR department to transition to the new program, which would start July 1st, 2021. The numbers you see in this slide are prorated for 2021 to account for this transition period. The base funding and total program amounts will be discussed during the NCR's budget presentation. Any adjustments to these will be made accordingly. With all these funding programs bring supportive services throughout the enterprise. As many are aware, NCR provides an array of programmatic support, but NCR will continue to partner with other city departments as we move to implement the new neighborhoods program, like Creative City Making, the Division of Race and Equity, the Health Department's Office of Violence Prevention, Division of Finance and Property Services, and the Office of Performance and Innovation. Next slide, please. As Director Rubidor previously mentioned in the beginning of this program, there was a multi-departmental endeavor utilizing a comment review committee consisting of amazing staff from various departments, which reviewed the public comments to identify themes, meanings, while identifying additional tweaks or languages or changes to the guidelines. Next slide. We received 354 public comments, which included 26 independent neighborhood comments, as well as 20 neighborhoods who co-signed a shared letter. Some of the highlights of the comments were an overall positive sentiment of the equity goal and the equity goals being supported. Some believe the goals of Neighborhoods 2020 do not go far enough in regards to equity. Some said at least $15,000 base funding is needed from the citywide base fund over the long term. NCR needed to provide more technical assistance and written guidelines to neighborhoods going forward. There was a number of comments requesting to increase the program funding from $4.1 million to $7 million. That was part of the 20 neighborhoods that combined on a joint letter. And then some reviewers recommended adding additional language in the program guidelines that explains the incentives to be recognized as a neighborhood association by the city. And lastly, a desire for additional assistance and technical support for neighborhood organizations to implement equity goals. Here, I do want to specifically mention Armitage, Tangletown, Nokomis East neighborhood as being the largest contributors to these public funds. Their outreach behind the Neighborhoods 2020 shows how neighborhood organizations rallying around a cause can create a broad audience to engage. Next slide, please. And Director Rubidor.
Yeah, I'll jump back in here. Thank you, Steve and C. Terrence, for providing that additional comments or conversation. The one thing I will just mention too, when Steve was talking about the public comment period, we did start that in early February. We extended that, the steering committee extended that several times, or a couple times actually, due to COVID and the civil unrest, and we ultimately closed that at the end of September. So it was open for about a 6-month period, which is unusually long, but we wanted to make sure that everybody that wanted to weigh in on this and comment on it could. Again, before you, these are the city council actions. I had mentioned these at the beginning. I do want to jump to the next slide though, and just as I mentioned, I wanted to, at the end of the presentation, just give a little bit more of a clarity on this one. So this one is about authorizing the continuation of the Neighborhoods 2020 Steering Committee until July 1st to look at some programmatic and legislative adjustments to the NRP program. The one thing that we, and C. Terrence hit on this, the one thing that we realized as we were going through this work is the community participation and now the Neighborhoods 2020 program moving forward is only a piece of a larger puzzle. This really is about how the city interacts with neighborhood organizations. It's about how departments collectively work together to support that. That's actually part of the, there's a community engagement evaluation going on right now that's looking at ways that could actually help improve those connections. But also that we have the NRP program out there, and just to put out the correct balance, it's around $30 million that's still left in that fund balance. lot of that is return funds, what is called program income, where neighborhoods have invested money and it's come back. But the bottom line on that is that there's still a lot of significant resources in that program. And what we would like to do is explore ways to basically look at ways to make that program more equitable as well. NRP is a laborious program administratively. It's very, very bureaucratic. And there are a lot of restrictions that are put on it by the state of Minnesota, the enabling statute, which limit our ability to really kind of, and neighborhoods' ability to use this from an equity lens. That became really apparent with COVID this year, and neighborhoods were trying to use those funds to really address some of the community needs and demands that were resulting were a result of COVID. Everything from business support to actually getting health and safety items out into the community, very limiting. So what we would like to do is be able to continue the work of Neighborhoods 2020 to bring in that NRP conversation, and then with the idea coming back to this committee by July 1st of 2021. Again, looking at this as it's a more of a comprehensive approach. But given the complexity, we want to bring Neighborhoods 2020 to you today, get that in place, and then move forward with the next step. So with that, next slide, that concludes our presentation. We're available for questions and looking forward to public comment.
Thank you, everyone, for your participation in presenting this work. Much appreciated. Lots of good information there. So at this point, I will open up the public hearing. Staff has provided me with the list of speakers. As is our typical practice, speakers will have 2 minutes each to present to the committee. And if you hear the buzzer, and when you hear the buzzer, your time is up. When you are called on to speak, please press *6 to unmute your phone. Please wait a moment for a recorded message that says you're unmuted before you begin speaking. With that, let me pull up the list here. So first up on our list today for the public hearing is John Shanahan, followed by Kaylee Brown with Courtney Sanders on deck. Mr. Shanahan, you have 2 minutes. And I do believe we may have some interpreters here. Do we have Mr. Shanahan on the line? Okay, we will circle back for that. Next up, we have, give me one moment. Okay, we will move on and we'll circle back to Mr. Shanahan. Next up, we have Kaylee Brown, followed by Courtney Sanders. Kaylee, if you want to push *6, wait a moment, and the floor is yours for 2 minutes.
Thank you, Chair Cunningham.
Welcome.
Hello, council members. Thanks for the opportunity to speak today. My name is Kaylee Brown. I'm the Executive Director of the Whittier Alliance Neighborhood Organization. We are located at 10 East 25th Street in Ward 10. And I know that there's likely a number of people that want to speak today, so I'll keep my comments brief. I just wanted to express Whittier Alliance's support for the overall structure and goals of the program guidelines. Though I think it's clear more detail regarding the actual administration of the program and the role of NCR in the success of the program still need further development. Whether fairly or not, when considering each organization's activities, makeup, and their priorities on their own merit, a major criticism that has often been applied to the entire neighborhood organization system to this point is that we do not operate and engage with our stakeholders in an equitable manner. And regardless of where each neighborhood organization is right now in their journey to pursuing justice and equity, in our view, I think these guidelines provide some previously non-existent teeth to ensure that if an organization is receiving city funds moving forward, then they must do what is necessary to make that transition. Over the last 3 years, Whittier Alliance has put in the work to identify and eradicate racism across our organization, to build intentional relationships and partnerships, and to repair the past harm that has been done. It's long-term, it's difficult work, but it has to happen across the city if we are to play a positive role in addressing our community's very real racial and economic disparities. I also believe that the city needs a strong neighborhood organization system to succeed in their own goals as outlined in the 2040 plan, whether it's engaging with residents, the process to reimagine models of community safety. So we are in support of the new program structure as a roadmap of sorts for all of the neighborhood organizations to serve as effective and influential partners in that work. Thanks for your time.
Thank you so much, Kaylee, for taking the time to be here today. Your voice matters, so thank you. Next up, we have Courtney Sanders, followed by Alex Palacios. Courtney, if you're on the line, please push *6, wait a moment, and then the floor is yours for 2 minutes. Do we have Courtney Sanders on the line? If you're there, please push *6. All right, we'll go ahead and circle back to Courtney.
This is Courtney.
Oh, yes. Hi, Courtney. Now we can hear you. Welcome. The floor is yours for 2 minutes. Thank you.
Yeah, just want to say thank you for opening up this hearing to the public and just calling in. I'm a 10-year resident of the city of Minneapolis, and I'm a renter. So one of the people that you're speaking about that is highly under involved in neighborhood communities and community groups. And I've, like I said, I've lived here for almost 10 years, and I've never even known that these neighborhood groups were receiving this kind of money from the city, had these kind of directives. And, it sounds like you guys are being responsive with creating the equity fund and kind of, making sure that there's a pot of funds that people can use for those sort of initiatives that really need to happen in the city. But I just feel really strongly that if we're using city funds for things like neighborhood groups, it sounds like there is some sort of directive, and forgive me, if I'm missing things because I'm new to this, but if the city and state, or it's probably city dollars, are providing money to neighborhoods, these neighborhood groups should have some directive from actual data and research, and they should have to actually try, it sounds like you're doing a lot of work around equity, but making sure that they address things for their neighborhood. And, with COVID too, being able to use those funds for emergency situations in neighborhoods seems really important too. So hopefully, maybe in addition to the equity fund, there needs to be emergency funds for neighborhood groups, because, none of us have seen the kind of things that we've seen in over 100 years that happen in Minneapolis and also across the globe. And so to make sure that those neighborhood groups can really be responsive to their community's needs is really important. And also just making sure people that are renters can know about this stuff. Thank you.
Thank you so much. Great to have you here. It's very important to have voices like yours involved in our process. So thank you so much for taking the time to be here today. Next up, we have Alex Palacios, followed by Morgan Whitman. Alex, if you are on the line, please push *6. Just wait a moment as the message lets you know you're unmuted, and the floor is yours. I'm not sure if Alex is still on the line with us. So we'll go ahead and move on to Morgan Whitman. Morgan, welcome. Please push *6, and the floor is yours. All right, we may not have Morgan Whitman on the line as well. We have, so that is all that we have on our line who is pre-registered to speak. Is there anyone else who is on the line who would like to speak today to this item of Neighborhoods 2020? If you are on the line, please push *6 and say your name for the record, and the floor is yours. All right, is there anyone? Yes, there we are.
Yeah.
Hello.
Hi, this is Alicia Gibson. I'm the president of the Lowry Hill East Neighborhood Association.
Welcome.
And apologies, I just wanted to know, are we talking about the totality of the presentation, or is there a specific part of it that you want us to keep our comments to?
To this item related to Neighborhoods 2020, whatever you would like to speak to related to it.
Okay, thank you. So I just wanted to say that I'm really happy that we've had the research into this and that we have this roadmap that really can help guide neighborhood associations in understanding how equity can be a part of the work that they do and should be a part of the work that they do. However, I just want to highlight some of the things that we've been doing pre-COVID and post-COVID. So before COVID, we had been doing organics recycling that have made organics recycling available to renters. And this is a program that has been acknowledged by the state legislature. And then there's work being done to figure out how to replicate this program and make it something that can be available to people across the city and across the state. We were probably one of the first organizations that I could figure out anywhere that provided sexual violence bystander intervention training to anybody in the community. And we had about 24 people take that. Since COVID, we have had de-escalation training so that people in our neighborhood, renters, homeowners, whoever, can learn ways to be peacemakers and peacekeepers in our neighborhoods. We built when it comes to public safety, we had an 800-member watch group that popped up immediately to really keep our eyes on the white supremacists who came in here to cause trouble in our neighborhood. And we also have been starting an ongoing public forum so that we can learn about the things going on in the different parts of the city. So the roadmap is important, but we can't drop the funding that makes it possible for us to have staff so that we can actually carry out all of this wonderful ideas and make the promise of equity happen at the neighborhood level.
Great, thank you so much for being here. And also just to note that we also will be having a public hearing related to the budget. So that might be a good opportunity for you to circle back as well, because we know some folks will be coming to speak specifically around the budget. So the budget related to Neighborhoods 2020. So just want to throw that out there for consideration as well. And thank you for being here today. Is there anyone else here? Of course, is there anyone else here to speak today to this Neighborhoods 2020 item? Please push *6. Please push *6 and then introduce yourself for the record. All right, I am not hearing anyone else. So with that, I will close this public hearing. And I will, I'll close the public hearing and we'll move approval of this item. With that, colleagues, is there any discussion related to this item? Councilmember Fletcher. Oh, I'm sorry, Councilmember Gordon, did you want to speak?
Yes, I did.
Okay, my apologies. Councilmember Gordon followed by Councilmember Fletcher.
Yeah, first of all, I really want to thank everybody for all the work in this, and I'm very supportive of all the actions I think before us today and the guidelines. I know we've worked on this a long time. I have to especially thank those of you who served on the steering committee. I have a small concerned that we want to keep the steering committee going forever because I know it was an intense amount of work, but I think it makes absolute sense to keep it going for a while, so I'm happy to support that as well. I did want to move a staff direction to maybe help us as we prepare for our future discussions about the budget. I wanted to direct staff to develop and present options for increasing the base funding to up to $25,000 for all neighborhood organizations, and request or direct them to report back to our next Public Health and Safety Committee meeting on November 19th. I'm happy to talk about that staff direction and see where people are, and I'm flexible about what to do, but I think it would be good if we could get some clear understanding and a presentation of what it might look like to increase that base funding as we're working and grappling with maybe making those decisions as part of the budget process. I know we had a lot of people who were emailing and asking us to consider that. I also know, and my colleagues will probably recall, how I made a motion, must have been a couple years ago now, to set that as the floor for the base funding for neighborhood organizations. So I'd like to keep looking at that, and maybe it isn't 25. Maybe it is 10, but maybe there's some room up for us to increase that base funding, because I do see a lot of good work that the neighborhood organizations do. And I think especially as we're turning to them more and more to help us achieve our goals and move forward the priorities that they have and that we have for the city.
All right, Councilmember Gordon, are you moving approval of the staff direction? Did you just want to put it out there for discussion? How would you like?
Yeah, I'd like to make an motion just for efficiency for the committee. So I'll move that staff direction.
Great, thank you for that. So Councilmember Gordon has moved approval of a staff direction that reads, direct staff to develop and present options for increasing the base funding to $25,000 for all neighborhood organizations at the next Public Health and Safety Committee meeting on November 19th. So that is the staff direction. I would like some clarification from Councilmember Gordon, if possible. Do you mean $25,000 within the current $4.1 million budget?
No, not necessarily. I mean, that could be an option, but I think that we saw what that would look like already. So no.
Okay.
I mean, it would be nice for staff to maybe recommend a way to find that funding. I know there are some reserves and some other issues, but I didn't want it necessarily to be restricted to that. In fact, I would prefer if it wasn't, because that's been the problem where we see what that does to our equitable funding formula.
Great. That's why I wanted to just get some clarification, because we have had that particular information presented, so didn't want to have to duplicate it if that's the information you were looking for. So thank you for that clarification. So now with this motion on the table for the staff direction, I see Councilmember Fletcher in queue. I'm assuming to speak to this motion.
Yes, thank you. So I guess I'm wondering what the staff direction does and why bring it back to this committee as opposed to the budget presentation that we know we're going to hear, which seems like a really appropriate place for them to lay out some scenarios for us. I mean, it feels like the math maybe isn't that hard if we're talking about something additive to know that, okay, well, 15,000 times however many neighborhood organizations, we could probably do it here, right? So like I'm trying to figure out what the value of the staff direction is, and I'll just signal I am in general not in favor of increasing base funding. I would prefer that if we were looking at additional investments, actually to speak to some of the feedback that we heard today about I think Courtney Sanders spoke about emergency funds, and I've been thinking along a similar line about sort of building resiliency capacity and thinking about in relationship to our transforming public safety work, if there were investments in neighborhoods that we might want to create more programmatic resources. And so I think I'm kind of open to you know, thinking about some budget conversations, but I want to make sure that I'm not signaling by supporting the staff direction that I am in favor of increasing base funding. Actually, I like the way that this neighborhood group has approached equity, and I want to make sure that that we continue in the spirit of that.
Thank you for that, Council Member Fletcher. Are there any other colleagues who would like to speak to this particular motion? All right. With that, I'm sorry, Councilmember Palmisano. I thought you wanted to speak to the main motion. My apologies, Councilmember Palmisano.
Hi there. Thank you. I see that Councilmember Gordon in the chat function said he would be fine bringing this to Budget Committee and through that process. I'm also supportive of that if there isn't enough time to report back to the next Public Health and Safety Committee meeting. I don't know, and I think my colleague and I were equally as confused as to whether this committee can direct such a thing into Budget Committee, but I'm supportive of that as chair of the Budget Committee. You know, I'm a little concerned that at the beginning of this presentation that we weren't real clear on what is and is not happening at Budget Committee on November 12th. There wouldn't be any action on the funding next week at Budget Committee on November 12th. It's a receive and file presentation that's about the entire NCR office. I think that Councilmember Gordon is requesting what kinds of things we'd like to see in it, and that would be increasing the base funding for neighborhood organizations in general. And I am supportive of that because I see this as a critical function of whether we have a network of neighborhood organizations or not. Neighborhood organizations are value adds to the city on a very micro public safety level. We have groups, these neighborhood organizations that bring people together, they introduce neighbors, they build community, and they do the hard work of our time, like we heard through some of the public hearing testimony today. I think that they are some of the strongest public safety investments that we have. And when we talk about investing outside of traditional law enforcement, I think it would be detrimental to lose these investments to inadequate funding. I don't know that a $10,000 base salary is going to help to, you know, I think the difference between being viable or not for 1 year could come down to simply whether or not they receive competitive funding or not. So I would be happy to move this into the budget conversation because it needs to be in context of all of our other competing needs across the city enterprise. So that's what I have to say, I guess, both about the main motion and about Councilmember Gordon's, I think, smart staff direction as well. Thanks.
Thank you, Councilmember Palmisano. I have Councilmember Gordon in queue.
So one of my questions has to do with the process, because I know that for a while now, all staff directions, at least for this entire term and maybe last term, go to the full council before they're actually approved. And I think the budget committee could take it up anyway, and maybe I'm sure I'll bring it up there, and so we can talk about that. But I'm just not quite sure if that's the appropriate action that we can direct to do from here. I also just wanted to note that I am very interested in exploring options that Councilmember Fletcher also lifted up in terms of funding to address certain priorities that the city might have. So I would love the opportunity to explore those as well. And this may give us a little bit of a better frame to explore those when we look at what kind of an increase would do and where some funding might come from, and what would be some of those trade-offs.
All right, thank you for that. I appreciate it. I would like to get some clarification from the clerk around the staff direction, given that it does say the next Public Health and Safety Committee meeting on November 19th, to see what language perhaps we should take up in this motion, just for clarity's sake. Madam Clerk or Mr. Carl, any guidance on that would be appreciated.
Mr. Chair, this is Casey. I don't want to overstep Irene. She is quite well versed, obviously, but I just wanted, since I did put into the chat the fact that you don't need a motion, obviously, to refer this to the Budget Committee. The Budget Committee has its own ability to bring this up, as I believe Councilmember Gordon even alluded. So, you know, if Councilmember Gordon wishes to just withdraw his proposed motion on the staff directive, the committee moves forward. This subject or question of funding amounts for neighborhood organizations can certainly be taken up within the Budget Committee, which is the proper place for that to happen. And either Councilmember Gordon or any other member could certainly raise that at the appropriate time. And I think the point here is to say that this motion could be withdrawn by the council member. The intent could certainly be taken up in the appropriate committee, which is the Budget Committee, on which all 13 council members sit. And that is where that conversation then could take place within the scope of the entire funding package for the city's operations in the fiscal year 2021.
Thank you for that clarification, Mr. Carl. With that additional information, Councilmember Gordon, did you have any follow-up thoughts around how to proceed? Councilmember Gordon.
Yeah, trying to gather my thoughts about how to proceed. So, we haven't discussed it at length here, but I think we did have a fruitful discussion. I suppose an option would be to hold this staff direction and make it on the 12th, perhaps as well, but maybe we'll get some good information from that. I do think that it might actually take some work on the part of staff in the budget office to explore some options and some strategies for doing this, because it's not really simple, or maybe I could have figured it out myself if it was super simple. So I will withdraw my motion with the understanding that this will be coming up at the Budget Committee, and I may bring the staff direction forward there. How's that sound?
Sounds great. Thank you for that. So Councilmember Gordon has withdrawn the motion, which takes us back to the main motion of approving the program guidelines that were presented today related to the council actions. I have Councilmember Palmisano in queue.
Thank you, Mr. Chair. I'm a little bit, can someone help me understand, probably Director Rubidor, the action, one of the parts of this action today is to approve guidelines and adopt the funding formula. If instead we are seeking to take up the funding formula, or rather the base funding amount in Budget Committee, which I'm happy to do, then is there language in this council action that discreetly states that the minimum base funding for neighborhood organizations is $10,000 or $12,000?
Chair Cunningham, if I may, Councilmember Palmisano, great question. No, we are not, and what I want to do is make sure that we're clear. What our intent is today is to approve the program guidelines and the funding formula, basically what C. Terrence walked through about what that formula would be. The level of money that would be going into the Neighborhood Network Fund, which is the one that actually sets the minimum base, is the piece that would be at discussion at your committee when this goes to the Budget Committee. And so any either additional money that comes into the program that could be targeted back into that specific program would raise, give us the ability to raise that. Or if the council chose to shuffle money, it doesn't change the formula. It would change the amount of money actually in that specific segmented program. So the formula stays the same. It's just less money going through the formula, if that's the direction we ended up going. Does that make sense?
I think so.
If I may, just think of it this way: the layout of where the money goes, how it's distributed between the funds, is static. It's a matter of how much money you plug into the neighborhood network fund, which could raise the base up, or if you keep it at the same level as currently what's in the recommendations, and it would phase down to $10,000. Or if you would move money out of the racial equity fund, it would lower the total amount of money going through there, but it would still be moved through that formula. So really what you're doing is today approving the program structure, the program formula, and we're basically moving that whole discussion about the total amount of money going into the entire package and the money going into the neighborhood network fund to your committee next week for discussion next week. I don't know if I helped that, if that's any better.
Chair Cunningham, if I may.
Yes, please.
I just want to make it clear that we're not taking any final action on November 12th at committee. We're having a conversation about it. But as is the typical budget process, it's really just a departmental conversation. It sounds like from what you said that there is a way then through the budget process to allocate more money that would essentially go toward the base funding of neighborhoods if that's the will of the council or not. But that I think what Councilmember, I don't mean to speak for Councilmember Gordon, I think what his interest is, I know what my interest is to find a way to increase the general base funding of neighborhoods without taking away from the racial equity piece. And that's what we're trying to find a way to do here.
Chair Cunningham, if I may, I would concur with everything you said, and my apologies for at the beginning of the presentation, Councilmember Palmisano. To be clear with the public as well, the budget discussion is an introduction of this conversation, and through the budget process, the council will deliberate this with ultimately making their decision in December.
Thank you.
Thank you for that clarification. That was very helpful to be able to break up what the decision is today and what's coming up related to the funding. So thank you for that clarification. Councilmember Gordon.
Yeah, I just wanted to acknowledge that I agree. I want to be able to move forward building that and addressing the equity disparities. In fact, one of the options might be to add funding to the whole pie, to the whole program, and then have it spread.
Councilmember Gordon, you got muted. I don't know how that happened.
You guys couldn't read all my hand signals. Sorry about that. I just was in agreement with Councilmember Palmisano that we wanted to make sure that the addressing the disparities and the formula, we supported that. One idea might also be to put money in the overall budget of all the Neighborhoods 2020 programs, and then we could see each one of those funds grow for a little bit too. In fact, thinking of this, we're probably going to need the budget office more involved and as involved as the NCR staff in helping to do this.
Thank you for that. I will just speak to this briefly. While I might be slightly biased, given that I was one of the co-chairs for the steering committee, I just have to say that I do feel very grateful for the work that has gone into these recommendations around the program guidelines themselves, the programmatic structure, what the future of neighborhood organizations look like in our city. We can dig into how much money goes into it, and I look forward to those conversations. I think that's some rigorous work that we need to dig into as policymakers. But with our motion here today, I believe that this is the right direction for us to be able to leverage the citywide network of neighborhood organizations to further our goals as a city enterprise. So both the city council and the mayor have agreed that racial equity is our primary goal, eliminating disparities. That's our #1 goal in our 2040 plan. It's in our goals in in all of the other components that we've worked on, we have named clearly that as an organization, the city is focused on eliminating racial disparities. And so therefore we have to use every tool at our disposal to be able to do that. I'm grateful for the work that Cura and C. Terrence brought to the table. It was incredibly informative as we were going through the process of how do we most effectively leverage the neighborhood organizations to further racial equity. And we did, as a council, give the clear directive to come back with a budget neutral recommendation. So that's why our next steps are for us to then begin having that conversation as policymakers. I really love the structure around the equitable programming, as well as the partnership with community-based organizations, and the way that it really equalizes power between the community-based organizations as well as neighborhood organizations. I'm really excited about the collaboration fund that was discussed. We really have an opportunity to be able to pool resources and expertise amongst neighborhood organizations in a way that also helps them be more competitive for outside funding, so that the city doesn't have to be the primary and only funder of the neighborhood organizations. And it also doesn't make them have to compete in a pool of 70 to be able to access those outside dollars. So some of them do, and some of them do that very well. But I think that this is just a really great way of thinking about structurally how do we want to see neighborhood organizations most appropriately, most effectively function as extensions of the city in some way. And so I want to thank so much Steve Gallagher, want to thank David Rubador, I want to thank C. Terrence and Brad Cousins, our city attorney, who helped us with it and helped us be able to figure out how to be able to move forward with the goals that we would like to be able to achieve through the work. This has been an incredibly long time coming. There was lots of work that has gone into this, and we are in a completely different place than we were a year and a half ago when the last time it came before the city council as an item specifically for us to take action on. So that really goes to the work of NCR, as well as Cura, as well as the neighborhood organizations who have consistently shown up, been involved with the conversations. We would not be here without all of their participation, community members who have taken their time to invest in what is the future of civic engagement in our city. We are very lucky to have this infrastructure in place of a citywide network of neighborhood associations, and I'm excited to see what's in the future for next steps with this work. So just thank you to everybody who's been involved. And with that, I have a motion on the floor to approve the council actions that are listed on the agenda, and I will ask the clerk to call the roll.
Councilmember Gordon?
Aye.
Kennel? Aye. Ellison? Palmisano?
Aye.
Fletcher?
Aye.
Chair Cunningham?
Aye.
There are 5 ayes.
That carries, and that recommendation will be forwarded to the city council, referred to the city council meeting next Friday for final action. Colleagues, next we'll move to the consent agenda. Before that, thank you again for that presentation and for everyone who joined us for the public hearing. We'll move on to the consent agenda, which is items 2 through 8. Item number 2 is accepting a grant from the U.S. Department of Housing and Urban Development for a 3.5-year period for correcting lead-based paint hazards and other housing-based health hazards in Minneapolis residential units for income-qualified properties. Item number 3 is accepting a grant from the Minnesota Department of Human Services Economic Assistance and Employment Support Division in the amount of $157,113 to assist sheltered and unsheltered homeless persons in obtaining essential services related to COVID-19 prevention and mitigation from October 1st, 2020 through September 30th of 2022. Item number 4 is accepting a grant from the Minnesota Department of Human Services Office of Economic Opportunity in the amount of $88,017 to support emergency food distribution services during the COVID-19 pandemic. Item number 5 is accepting a grant from the Minnesota Department of Health in the amount of $769,838 for work under the statewide Health Improvement Partnership for the period of November 1st of this year through October 31st, 2021. A passage of a resolution accepting the donation from Kidda Fire Safety Products of smoke alarms to the Minneapolis Fire Department to distribute to City of Minneapolis residents. Item number 7 is setting a public hearing for November 19th, 2020 to consider the appointment by the Executive Committee of Brian Tyner to the appointed position of Fire Chief for a 2-year term beginning January 2nd, 2020. And item number 8 is approving council and mayoral appointments to the Police Conduct Oversight Commission. With that, I will move approval of the consent agenda. Are there any comments, questions, or items that folks would like to pull for more discussion? All right, not hearing any. I just want to take a quick moment to talk about, I believe it's item number 4, and really just be able to name that's really exciting work related to particularly serving the Latinx community. So I want to give a shout out to Noya Woodrich for her work with that. It's incredibly important that we are leveraging all resources as much as possible to be able to serve all of our cultural communities. So thank you for that. And also for item number 3, that I want to also make sure that folks know that it's going to be actually sub-granted to 2 organizations, the Aliveness Project and Indigenous Peoples Task Force, and that's really going to be doing some great work around supporting folks who are IV drug users to be able to help them with the substance abuse issues as well as HIV prevention and also with COVID-19 prevention as well. So really pulling together multiple needs there. We have an amazing staff of hardworking folks who really dig deep into finding outside dollars that could be invested into our community. And then the last thing I want to mention is related to the smoke detectors. What a great donation. So thank you to Kidda Fire for doing that. They are going to begin by distributing them through the city's community full service community schools as a way to ensure that we are distributing the resources, prioritizing through to BIPOC communities, and then what's left then will be sent to the fire stations for anybody to be able to come and to be able to get some. So that's a really great resource and really innovative thinking about how do we get the resources to the folks who need them the most urgently. So so thank you to everybody in the fire department as well as the donors for making that happen. I have Councilmember Palmisano in queue.
Thank you, Mr. Chair. I just briefly wanted to mention item number 8, the new PCOC appointments. Our Police Conduct Oversight Commission has been down a number of members for too long. I am thrilled to have been able to personally participate in this process. We had so many really great candidates that each would add their own unique piece to this commission, which I invest a lot of time and energy in, and I know some of the rest of you do as well. So I just wanted to celebrate these new members of PCOC as this action goes through council. These are some really great volunteers that want to be part of this commission.
Thank you for that, Councilmember Palmisano. I 100% agree. I'm very excited for this work to be up and running. Right now is just an incredibly critical time for the Police Conduct Oversight Commission to be up and running as we're having these really big conversations around the future of public safety, which includes the future of policing in our city. So thank you for bringing that up and highlighting that. Great. Well, that is all that I see in queue. So I have moved approval for the consent items number 2 through 8. And I will ask the clerk to please call the roll.
Councilmember Gordon?
Aye.
Cano?
Aye.
Ellison? Palmisano?
Aye.
Fletcher?
Aye.
Cunningham?
Aye.
There are 5 ayes.
Those items carry, and the consent agenda is approved. We'll now move on to our final item for today, which is item number 9, an update on the 911 MPD work group. I will invite staff to give that presentation. I know we have quite a few folks who will be helping give this presentation. Lots of robust work happened. So I will turn it over to staff from here. Thank you so much.
Good afternoon, Committee Chair Cunningham and council members. I'm Gina Allen from the program manager on the Performance and Innovation team, and I'll be presenting an update on the public safety work that my team and others are working on, which includes alternative to police response pilot recommendations for 2021 from the 911 MPD work group, an update on the implementation plan for transition of theft report only calls from 911 and MPD to 311, and an update on the conversations with departments to transition additional problem nature codes to them from MPD. I am joined here today by my OPI colleagues, Mwanya Onyuke, Taylor Crouch-Dodson, Jonathan Williams Kinsel. We are also fortunate to have Nicole Weiler, a community member on the 911 MPD work group, helping to present this work today. I know there's a lot of us, and I think that speaks to the depth of the work taking place and is much more exciting than hearing me talk the entire time. Next slide. I will briefly walk you through the background of the work group, then turn it over to Taylor to go over the survey findings that help to inform the work you will hear today. We will then discuss the recommendations. Next slide. And next slide. Thank you. Last fall, a work group was formed to analyze dispatch call categories to determine whether there were opportunities to expand the city's ability to respond to 911 calls beyond the Minneapolis Police Department. The group started with a list of all problem nature codes and narrowed that down to emotionally disturbed person calls, also known as EDP or mental health crisis calls, and report only 911 calls, for their potential to have a high degree of impact for residents and MPD workload. Several ideas arose as needing further exploration to determine viability for pilot. And starting with this list of ideas, we worked to increase the levels of community engagement throughout the process by creating 2 surveys to gain broader community input into the alternative solutions and asking community members to lead the development of the recommendations you will see today. Next slide, please. And I will hand it off to Taylor.
Thank you, Gina. Good afternoon, Committee Chair Cunningham and council members. My name is Taylor Crouch-Dodson, and I'm a planner analyst with the Office of Performance and Innovation.
Today I'll be sharing with y'all the results from two resident surveys we created to better understand the lived experiences of those reporting mental health crises and non-emergency crimes to the city. I'll plan to take a pause in between the two surveys to see if anyone has questions. Otherwise, please feel free to interrupt me for clarification as needed. Before we dive into the data, I'd like to ground this conversation with some high-level key findings that were identified across both surveys. Many people expressed that they called 911 for help, even though they were uncomfortable with the choice. This discomfort is connected to the likelihood that police will respond even though their presence is not wanted or needed. Overall, folks want excellent customer service and empathetic treatment when reporting incidents to the city. In addition, people value autonomy. They want the ability to choose how they report their incidents and who responds. Finally, many did not request police presence when reporting because they wanted to protect themselves or others from police violence. Respondents were particularly protective of their Black, Indigenous, and neighbors of color. Many referenced the recent murder of George Floyd and the ongoing realities of police violence nationwide as an influencing factor when choosing to report incidents to the city or not. Next slide, please. We were very pleased with the response rates for both surveys. We partnered with communications and local agencies to engage residents via social media. The response rates are visualized to your right for each survey. Between the two surveys, our team of 5 staff analyzed responses from more than 8,000 people, including over 23,000 individual open-ended statements. First, we will discuss the mental health crisis survey. Next slide, please. The purpose of this survey was to help our city gather info on people's experiences when experiencing or witnessing a mental health crisis. Some key takeaways from this slide include that a majority of people do not call for help, and a majority of people who have a close relationship with the person in crisis. You'll see that from the top 3 relationships listed: friend, myself, and family member. Next slide. Demographic questions for this survey were optional, and you'll see that less than 40% of survey participants answered the demographic questions. Majority of people who did answer these questions identified as white, straight, women, and between the ages of 25 to 34. We do not know the demographics of the other 60% of respondents, so we cannot make assumptions of their identities since these questions were optional. Our team recognizes that these demographic breakdowns do not reflect the racial makeup of the city. That's why later in this presentation, my colleagues will share how we engage with Black, Indigenous, and people of color in workshops that were pivotal to the development of our recommendations. Therefore, these survey results are just one piece of information used to inform our work. Next slide. First, let's look at the 2 charts on our left. You'll see that a majority of respondents called 911 for help and interacted with police when experiencing or witnessing a crisis. In contrast, only 5% of respondents called a social worker or mental health professional during a crisis. Let's compare those findings with the chart on the right. Respondents were asked to rate how comfortable they were with a set of predefined options. From the bottom, people were uncomfortable interacting with 911 and police. As we move to the top, people were most comfortable interacting with COPE, social workers, and the crisis helpline. We believe it is important to note that while COPE received the highest comfort rating within this list of options, most people did not name COPE as a preferred responder for mental health crisis calls. Next slide. People were asked to rate a predefined list of response characteristics by importance. From the top, we see that an overwhelming number of respondents indicated that proper treatment of people, feeling safe, and quick response times were very important. In addition, a majority of people indicated that it is not important that responders have a weapon or wear uniforms. Next slide. In each survey, we provided respondents with some open-ended questions, and we took those responses and conducted a qualitative analysis by coding their answers by themes. This slide shows how frequent each theme appeared in people's answers. So when we start on the left, we see that a majority of people prefer a mental health professional or a social worker to respond to a crisis. In contrast, very few people prefer the current co-responder model and even less prefer a police officer, as we see towards the bottom. When we move to the right, people want mental health responders to be well-trained, unarmed, and have access to resources. In particular, they mentioned having a trauma-informed professional trained in de-escalation and crisis intervention. They also want the responders to be community-based with cultural understanding so they can have a direct connection with the folks they serve in crisis. This will conclude the mental health crisis survey portion of my presentation, and I'll move on to the non-emergency crime survey. But before I proceed, I'll pause for any questions. Okay, hearing none, we can go on to the next slide. So the second survey was about non-emergency crimes, and the purpose was to help the city gather information on people's experiences when reporting. In particular, we focused on 3 crime types: nonviolent theft, such as a stolen bike; property damage, such as graffiti; and parking or traffic issue, which would be like a parked car obstructing your road. Next slide. Just like the mental health survey, demographic questions for this survey were also optional. You'll see that about 70% of survey respondents answered the demographic questions. Therefore, we cannot make assumptions on the 30% that did not answer. Majority of people who did answer these questions identified as white, women, straight, and between the ages of 25 to 34 years old. Again, our team recognizes that these demographic breakdowns do not reflect the racial makeup of our city. And as a reminder, these results are just one piece of information used to inform our work. Next slide. On this slide, we see at the top how many people experienced and reported each of these crimes. A major takeaway from this slide is that regardless of the crime, majority of people report the incident to the city. This demand emphasizes the need for our reporting process to meet the needs of residents. Next slide. At the top of this slide, you'll see how many people requested police presence when reporting a crime to the city. We then asked people to explain why. We will start with a few that did request police presence. Here are the top 2 themes we found. People wanted their crime to be tracked in a record management system with adequate data entry and evidence collected from the scene. Also, respondents felt their incidents demanded immediate in-person responses given the urgency and severity of the issue. Next slide. We will now compare that to the larger group of people who did not request police presence when reporting to the city. Top 2 themes include, first, regardless of crime type, people wanted to protect their neighbors, especially their Black, Indigenous, and neighbors of color, from police violence. In addition, respondents indicated that police presence was unnecessary or unwanted for their incident. This connects with themes of low urgency, low value of damage, and no evidence to collect. These themes mirror our insights from the mental health crisis survey, in which people believe police are unsafe or unnecessary in a crisis and prefer an unarmed community-based responder. Next slide. Similar to the mental health crisis survey, we asked people to rate how comfortable they were with each option. At the bottom of the slide was how many people reported their incident to the city. Here we see that a majority of people reported property damage or nonviolent theft via calling 911. Yet people are most uncomfortable calling 911. In comparison, people were most comfortable calling 311 or using the 311 website to complete a form. These sentiments directly align with our mental health crisis survey, in which people were most uncomfortable calling 911 and interacting with police. Again, we are seeing themes across all different crime and reporting types. Next slide. At the end, we asked people to describe their ideal reporting process for future non-emergency crimes. 3 key themes emerged. First, people prefer a customer service type reporting process that's dedicated to reaching a resolution in an empathetic and respectful manner. Respondents prefer phone, digital, and online reporting options that's not connected to 911 or police. And third, People want to see ongoing process improvements to reporting options to stay current and reliable while meeting the needs of residents. This will conclude the non-emergency crime survey portion, and next I'll share some key takeaways and conclusions. Before I proceed, I will pause for questions.
Are there any questions from my colleagues? All right, thank you so much. Feel free to continue.
Thank you, Committee Chair Cunningham. Next slide. Next slide, please. Oh, I'm sorry. So the following findings from each survey were used to develop our recommendations. First, from the mental health crisis survey, a majority of people experiencing or witnessing a mental health crisis do not report the incident and have a personal connection with the individual in crisis. Therefore, we'll be recommending ways to engage and educate the community about their service options. When people do ask for help, they end up calling 911 despite being uncomfortable with the process due to fear of police response and escalating the situation with violence. In contrast, people are comfortable interacting with social workers and mental health professionals. Therefore, we will be recommending enhanced training for 911 dispatchers, as well as embedding a mental health professional in 911 to enhance the response process. Finally, people value being treated with respect. They also value having a sense of safety, a quick response time, and want professionals with proper training to respond to crises. Therefore, we will be recommending the city equip a mental health professional and EMT team to respond to future EDP calls. For the non-emergency crime survey, we found the majority of people experiencing a crime actually report it to the city and have not requested police presence because police make them feel unsafe, are unhelpful in resolving the situation, or are unnecessary for the type of incident. Therefore, we will be recommending a new set of city staff to handle these calls that are not sworn officers. People are also most comfortable reporting to 311, whether by phone or online, but fewer respondents use it than 911. In addition, people value a customer service approach that does not include a sworn officer response when reporting their non-emergency crime to the city. Therefore, we will be recommending transferring calls to 311 customer service agents, developing a comprehensive online reporting system, and initiating an awareness campaign to residents so they know their options can make the best decisions to meet their needs. This concludes the survey results portion of our presentation. I'll pause here before I hand it back over to Gina.
Thank you so much.
Okay, hearing no questions, thank you, Committee Chair Cunningham and council members. I will hand this presentation back to Gina Allen to discuss our recommendations.
Thank you, Taylor. I'll now give a brief overview of the prototyping workshops that were facilitated and then move to discuss the pilot recommendations that came out of them. Next slide, please. As an update, we are currently in the experiment and design phases of the inclusive design process. Many ideas for alternative responses and or characteristics of those responses have been narrowed down, with some recommended for pilot and others that can move straight to implementation, all of which would be evaluated along the way. Next slide. As Taylor described, the insights from the survey respondents were used to ground the community-centered prototyping workshops. Normally, these sessions would be a robust in-person experience, but due to COVID, our team worked to translate them into an online, COVID-friendly format to ensure the safety of both residents and staff. We used an interactive online collaborative tool to mimic this experience. And on this slide, you can see screenshots of several of the activities that took place. Given that the 911 MPD work group consisted of more staff members than community, some feedback we received was that staff voice sometimes overshadowed that of community. To address this issue, our team worked with NCR, our neighborhood and community relations team, to identify additional residents to participate in the workshops. We prioritized participation of BIPOC, given the demographic information reflected in the surveys and the data that shows disproportionate impact of these issues on BIPOC. We also reduced the number of staff in the first 2 workshops while having the final workshop be only community members so that they could vote on recommendations freely. The recommendations that follow are truly driven by the community. Next slide. The set of mental health recommendations is best thought of as a package deal. They are an effort to address mental health crisis calls from a holistic perspective by making improvements to each stage of a call for service. By taking a multi-pronged approach, the hope is that the person in crisis gets the best experience possible, all the way from before a call begins until responders arrive to provide that service. Any one of these on their own would not be as effective as a symbiotic relationship that they have the potential to create together. We're now ready to go through the recommendations. As we describe them, we will provide details on what the pilot or implementation may look like, along with the cost range, high-level timeline, and considerations to keep in mind. Next slide. I'll be working backwards through the mental health pilot recommendations so that we can talk about the actual alternate response that folks would receive when experiencing a crisis, since that was the primary aim of our work. Dispatching mobile crisis teams focuses on the fact that many responders do not have specialized training in mental health, and we want to ensure that community gets the help that is most supportive of their needs. Also, data shows us that most mental health calls are nonviolent and do not require a police response. Next slide. This pilot would consist of mobile crisis teams made up of mental health providers and an EMT or other medical professional, such as a psychiatric nurse. Teams will respond to low-risk mental health calls across Minneapolis that do not involve a weapon and where there is no immediate safety risk to self or others. Communities stress the desire for these responders to be unarmed, dressed down, have extensive de-escalation training, and be diverse in race and gender to best serve our cultural communities. Next slide. Here you can see the cost, timing, and considerations for this pilot recommendation. Reflected in the cost are FTEs for the teams and equipment. Costs will vary depending on the number of shifts and type of equipment that is used. And the biggest considerations are that we may see an increase in mental health calls as residents learn about the non-police response option, and that many partners should be considered for this project, both those within government and community-based providers. Next slide. Our second recommendation is to provide specialized mental health training to 911 staff. This focuses on the need to provide the most appropriate response to mental health calls. Right now, mental health calls are coded together as EDP or emotionally disturbed person, even though a one-size-fits-all approach does not allow for the best service to residents. Next slide. Emergency dispatchers are often the first point of contact when a caller is experiencing a mental health crisis. This pilot aims to ensure that from that first call, the city is able to provide residents with a high-quality service as it relates to their mental health needs. Equipping our 911 call takers and dispatchers with specialized training in emergency mental health dispatch will help ensure that they have what they need to recognize mental health factors in all call types, pass that information on to responders, and know when to dispatch the mobile crisis teams described in the previous slides. Next slide. Again, you can see some of the details of the pilot here. An important consideration to keep in mind is that we could see the volume of mental health related calls increase if calls that would have previously been coded differently, such as suspicious or unwanted person, are now recognized as needing a mental health response. Next slide. Similar to the previous recommendation, embedding mental health professionals in 911 will help to triage calls so that eligible mental health calls receive a specialized mental health response. Next slide, thank you. For this pilot, mental health professionals will be housed in our 911 call center. This may allow the city to thoroughly triage these calls to determine the best response of the available options, and in some cases, divert the calls, thereby not even requiring an in-person response. As a note, Hennepin County will be launching a pilot for a social worker to work within their 911 call center, and that pilot will begin in January. Next slide. With this pilot, we see some similar considerations as other recommendations, such as thinking broadly about where the mental health professionals could come from and the potential for an increase in mental health call volume and its impact on that demand for the mobile crisis teams. I will now pass it to Nicole Weiler to present the final mental health pilot recommendation.
Welcome. I'm just going to take one quick moment here. We have Councilmember Gordon in queue.
Thank you so much. I just wanted to get clear on those last three recommendations. Are those three distinct recommendations? Because it almost looked like the recommendation on the pilot and then the recommendation to embed the mental health professionals were very similar, and I wasn't sure if they were complementary to each other.
Chair Cunningham and Councilmember Gordon, thank you for that question. Those are two related but somewhat distinct recommendations. And so for those two, since they are addressing a similar need of making sure that we can triage the calls to get them to the mobile crisis teams, that we could try one or the other, or we could try both to see which ones produce the most effective outcomes for residents.
And if I wanted to try to figure out what it would cost to give us a 24-hour, 7 days a week coverage, because for the embedded mental health professionals, which could be maybe mental health professionals and EMTs, this is in the, I think that would be in, let me see here, I guess, number 3. What do you think the costs are? Because the costs say from between $205,000 to $610,000, depending on how many shifts would be covered and the number of professionals per shift. Did you guys analyze that with a little bit more detail?
We did, and we can certainly follow up with that more detailed breakdown after this meeting, and I can get that to you.
That would be great. Thank you.
Mm-hmm.
All right, thank you so much. We will now welcome Nicole. Thank you so much for taking the time to be here today and for your service. Do we have Nicole on the line? Gina, I'm not seeing, let me see. Gina, I'm not seeing Nicole. Maybe I'm confused, but if you can clarify what's going on.
I am not sure. I believe she received the invite, but I could certainly speak to this and, yep.
Okay, let's go ahead and go with that. Thank you.
Yes. So for this recommendation, we wanted to provide de-escalation and community trainings to members of our community, such as QPR training, which stands for Question, Persuade, Refer, which is similar to CPR in that when someone is having breathing difficulties, bystanders can respond on the spot. And so for QPR is recognizing those same kind of issues as they relate to suicide and being able to intervene and provide a service, whether that is supporting that person yourself or potentially calling 911 and getting them to services to help them work through that crisis. Next slide, please. And so what this pilot would look like would be to provide a micro grant to community leaders. And we're defining community leaders broadly in this sense. So not only those who are recognized leaders of established nonprofit organizations or neighborhood organizations, though those would be included. We also want to recognize that there are folks on the ground responding to these issues, especially after the uprisings. And so we want to include them in this process as well. And this would really help communities to support each other and potentially prevent some of those calls from getting to 911 if they're able to provide enough support for the person in crisis, or if they are going to 911, being able to provide the dispatcher with adequate information so that they can begin assessing that call and get the right response to that community member. And again, here you see some of the costs associated with that, which include the training fees for community members, funding for those micro grants so that those community members can be paid a market rate wage for their work, because they would be the ones identifying folks within their unique communities to train after their kind of train the trainer training. And oh, sorry, one more thing on that one. Just wanted to highlight that this one could be one of the considerations of this one is training enough community members to really be able to measure an impact. And this would go in kind of a cohort-based process. And again, this could increase the demand for those mobile crisis teams if more community members are learning that this is an option and police involvement doesn't have to be a factor. Next slide, please. All right, and now I will pass that over to Mwanya, who will take us through the reporting recommendations.
Welcome, thank you so much.
All right, thank you, Gina. Good afternoon, Community Chair Cunningham and council members. My name is Mwanya Onyuke. I'm a planner analyst with the Office of Performance and Innovation. Today, I'll be sharing with you the 911 and MPD work group recommendations for reporting non-emergency crimes. Next slide, please. The top 4 reporting problem nature codes account for about 6% of all MPD call volume. However, these calls tend to take up a lot of time, accounting for about 10 to 15% of officer time spent on calls. We focused on these non-emergency reporting issues because we felt that they were low risk, but they could have a high impact in regards to freeing up MPD officers to focus on more pressing issues. Today, I will go over 3 recommendations to implement and 2 recommendations to pilot, and these recommendations are currently in front of you. Next slide, please. The first recommendation for reporting non-emergency crimes is to direct property damage and report only and parking calls to 311. For this recommendation, we identified a need of community members, that is, non-emergency issues should go to non-emergency responders and not 911 or MPD, allowing 911 and MPD to focus on more emergent issues. From the survey results, you see that respondents are more comfortable with 311 and reporting to 311 than any of the other options, regardless of the crime type. Thank you. We would like to implement this recommendation because 311 currently takes these type of reports. This recommendation will completely transfer the responsibility of taking non-emergency reports to 311. This will free up 911 and MPD by decreasing their call volume and allowing them to focus their efforts on emergencies and high priority crimes. This will also allow us to reduce duplicative services in the city, as now 311 will be the sole party responsible for these report-only calls. I would also like to add that 311 agents are trained to be excellent customer service representatives for the city, and they provide residents with solutions for their concerns. Next slide, please. Here you see the cost, timing, and some considerations. The main components of the cost will be personnel and equipment for 311. One of the main considerations for this recommendation is that it takes about 4 to 5 months for 311 staff to be fully trained. This means that the sooner that they are hired, the sooner they can start taking these calls. Next slide, please. The second recommendation for reporting non-emergency crimes is to create one comprehensive online reporting system. For this recommendation, we identified a community need, that is, residents want to have an online reporting option that is simple, efficient, transparent, and accessible. And when we think about accessible, we're talking about being able to translate into different languages and being easy to use. Now, both the surveys and the work group identified the need for reporting non-emergency crimes via a friendly online system that can receive a wide variety of issues with a status tracker and an immediate response that they can use for insurance. Next slide, please. We would like to implement this recommendation because our current 301 and police websites can be a little bit confusing and require residents to figure out where they can make the report. We want to reduce this confusion, and this will also allow the city to improve the way with which we route calls that are reported online to our various city responders. The main goal of this recommendation really is to, as I said before, is to provide residents with a simple, efficient, transferable, and accessible system. This recommendation will also allow us as a city to provide residents with a new experience, allowing them to regain their autonomy and feel empowered to use city services to resolve their issues. Creating a friendly and accessible system that lets residents track their service requests creates an accountable approach to reporting that will instill trust in our residents and will also potentially reduce the instances of multiple requests for the same issue. Next slide, please. The City of Minneapolis IT department has let us know that they may not have the capacity to do this internally. However, and this is because of their priorities, so we will need to collaborate with external partners to make this come to a reality. Creating an online reporting tool that gives residents the best experience and makes our internal process more efficient is not a minor undertaking. The implementation will take anywhere between 6 to 10 months because it involves custom and complicated technology builds. I would also like to add that survey respondents expressed the need for transparency in the process. They want to know what happens to the report after it's taken. They want to know the next steps in the process, and they want to have follow-ups. Upgrading our online reporting services, giving residents the ability to track their cases, will get us one step closer to that transparency and accountability that we strive for as a city. Next slide, please. The third recommendation for reporting non-emergency crimes is to conduct an awareness campaign about reporting options via 311. For this recommendation, we identified the need for residents to be aware of the reporting options available and the appropriate ways to use them. The work group identified the need for the city to be more closely engaged with residents and establish ongoing intentional and culturally competent relationships with our residents. The work group also identified that there needs to be a clear list of steps online for how to report these various issues. Next slide, please. We would like to implement this recommendation because as we think about moving calls away from 911 and MPD and changing city processes, it is important for us to educate our residents and make them aware of all the process changes. Promoting this guide to reporting will help us and residents empower them and give them the autonomy to use city services in the right way to resolve their issues. Next slide, please. The cost of the implementation will be heavily dependent on the different reporting options, the strategies, and the mediums that we use to spread awareness. We will continuously evaluate the effectiveness of our messaging throughout the whole process to ensure that we are pushing the right messages at the right times and to the right people. Next slide, please. The fourth recommendation for reporting non-emergency crimes is to train a non-police city staff to take theft and property damage reports and potentially collect evidence. When asked what the ideal reporting experience looked like for reporting non-emergency crimes, when it came to in-person responses, respondents expressed that they want an unarmed, dressed-down city staff with specialized training and excellent customer service to respond to their non-emergency needs. Next slide, please. We would like to pilot this recommendation because this would be a new level of service the city would be providing. 301 currently takes reports over the phone. However, in certain cases, there may arise a need for an in-person response to take these reports. When necessary, we would like to be able to provide residents with this in-person response that is quick and provides excellent customer service and helps residents resolve their issues. You know, reading through a few thousand survey responses from the Minneapolis residents, it was clear that they felt that when they report crimes with the current system, they felt unheard, and at times, you know, they felt unheard at times, and they really did express that they would like an empathetic response, and they really just wanted to feel heard and to feel like the issue that they were reporting mattered. Next slide, please. Now, this will be a new service in the city, and there will have to be a lot of trial and error as we go through this process. As we pilot this recommendation, we want to learn what works and what doesn't, and during the pilot, this will allow us to adjust accordingly until we find the best way to provide this service to our residents. And this is why we're recommending this for a pilot. Next slide, please. The fifth and final recommendation for reporting non-emergency crimes is to transfer parking-related call responses to traffic control. For this recommendation, we identify the need of community that is non-emergency issues, once again, should be handled by a non-emergency responder and not 911 and MPD, who have more pressing issues to attend to. As I mentioned earlier, and as you saw in the survey responses and the work group sessions, residents would like an unarmed response that can help with enforcement and resolution of their non-emergency parking concerns. And our traffic control meets this criteria. Next slide, please. We would like to pilot this recommendation because traffic control currently responds to these parking calls. However, they do have limited hours. The pilot will help us understand what it would take to completely transfer the responsibility of responding to these parking calls to traffic control. This pilot will involve expanding the operating hours of regulatory services and traffic control agents. This could come in the form of expanding shifts or giving current staff overtime. But this is what we will learn as we design the pilot. Traffic control agents are trained to be excellent customer service representatives for the city, and they do provide residents with resolutions for their parking concerns. Next slide, please. We know that traffic control already responds to most parking calls during the daytime. However, they have limited operating hours. In the hours when they are closed, this is when MPD responds to a majority of the parking problems. It will be important for us to design the pilot in a way that accounts for traffic control's limited hours. However, understanding the high volume of parking calls that police respond to happen between 5 p.m. and 1 a.m., and as we look into potentially expanding traffic control's hours for the pilot. And with this, I conclude the recommendations for the non-emergency reporting crimes. And I'll now be handing the next section of this presentation to my colleague, Gina. Thank you for your time. Next slide.
Thank you.
Thank you, Monia. And we were having a few technical difficulties because our community member, Nicole Weiler, says she is in the meeting. So we were trying to figure out if we were able to go back to one of the recommendations so she could cover it more thoroughly. And Chair Cunningham, I'm not sure where we are at with that. So if IT could let me know if I should just continue or if we're able to get her on.
If she is logged in, does she have the ability to unmute herself? We just don't see her logged in, but if she's saying she is.
Okay. Then I will continue and close us out. 1 second. Well, that's the end of the pilot recommendation presentation that we have prepared for you today. There is additional information included in the appendix regarding the racial equity impact assessment, particularly on how these programs stand to reduce the contact with law enforcement for Black, Indigenous, and people of color. I'd like to offer my appreciation to all community members, city staff, and subject matter experts who invested in this work over the last year and a half. And thank you, Committee Chair Cunningham and council members for having us here today. We are available for questions before we move into the next two presentations.
Thank you for that. Councilmember Palmisano, followed by Councilmember Fletcher.
Thank you. This is really exciting stuff. Thank you for all of this work. I do have a couple of questions, and I'm not sure who it's for. So I guess if I could direct them to Gina, and you can weigh in as to who might. I'm curious. This goes way back to Mr. Crouch Dodson's part of the presentation. You had said that part of your effort to gain knowledge about how the public felt about these were from surveys, and then you also mentioned focus groups. But were there other ways that you came to these recommendations? Like, for example, were mental health professionals consulted on how we would design a new response, and how? Like, can you tell me, was it a professional group or were they individuals? Can you help me understand how mental health professionals were part of coming forward with these recommendations? And I have a couple other questions too, but I think I should pause after that one.
Chair Cunningham, Councilmember Palmisano, this is Brian Smith, Director of Performance and Innovation. Good afternoon. Taylor's likely not the best person to answer that question. The person who had the most intimate knowledge of it would be Gina, since she was the project manager for the 311 911 work group, and the answer is yes, and she can speak to the list of people that we did have involved in that process.
Thank you, Chair Cunningham and Councilmember Palmisano and Brian. Yes, we did consult with a variety of mental health providers from different organizations. We spoke with members of COPE, members of community-based providers, and also have conversations that are going to be following as we're developing the specific details of the pilot recommendations. We also have spoken with NAMI and the executive director there, Sue Aberholden, as well as speaking with several programs similar to this across our country, one of which being Denver Star, who operates a similar pilot program currently.
So in your efforts with these groups, have you found people interested in participating in such a pilot on the provider side of this work?
Specific conversations about who would actually be on those mobile crisis teams, those conversations are in process, and we were waiting to hear what direction council was wanting to go with the recommendations before we got kind of more into those details. However, we also did hear that there would be some interest in being a part of this program. Great.
Chair Cunningham, if I may, I have another question about the 311 piece.
Yes, of course.
I appreciate that these survey results show that people have the greatest comfort in calling 911. And it's clear from this data that they want a government official to report these incidents to. But did you go so far in the survey to see if they are then satisfied with 311 to solve their problem, right? For example, trying to think of a constituent example, modifying a police report that they've made because they found more things missing, right, of their property. Have we gotten through to that part of it?
And I believe I will pass that question to Mwanya, who has been working both closely on the survey and with 311 in the theft report only implementation plan. So Mwanya, if you have some insight to that you'd like to share.
Yeah, of course. Thank you, Gina. So I've been working with 311 to develop the implementation plan to transfer theft reports. So that's already underway. And during this process, what we've learned is that 311, they will need additional access to PIMS, which is the system in which the reports are entered. Now, to get this additional access, MPD would need to provide them this additional access. It is something that Trish has expressed that she needs. And in my presentation, actually, it was something I was going to bring up as one of the outstanding issues in the implementation plan. So we do know that it is something that is possible because there are various departments. There are various non-MPD departments in the city that do use PIMS and have that increased access, you know, be that OPCR or certain departments in regulatory services. So it is something that is possible for 311 to do and something that we are looking into, especially if we're trying to give residents the best service possible, right? We don't want to be bouncing them around. You want them to be able to call 311 to say, hey, I'm giving you this report. Oh, I have additional information. Can you enter this report for me? So it is something that we are currently working on. Thank you.
And then I guess my last part of that was just, Mwanya, were residents familiar with the current hours of operation, or did they weigh in on what appropriate hours of that kind of service might be? I think they could realize it would not be a 24/7 kind of operation.
Yes. Reading the qualitative responses, it came up here and there, knowing that 311 is not a 24/7 response, is not a 24/7 operation. I will say in the implementation plan, kind of when I go through it, it is something that we did address. You know, there are workarounds with that, whether that be, you know, when residents do call 311, you know, if residents call 311 and 311 is closed, they get a voicemail that lets them know that they can report online, which will be the exact same thing as reporting over the phone, or they can call back during business hours. Also, if they do call 911 to report 911 and 311 is closed, 911 also gives them that message, letting them know that they can report online, or they could call back 311 during the regular business hours. So it was a consideration when we looked into the implementation plan.
Thank you very much.
Of course.
Thank you. Councilmember Fletcher.
Thank you, Chair Cunningham, and thank you to the entire team that's worked on this. There's some incredible work here, and I think it's really valuable to have this kind of feedback. And what I really love about this is that we are challenging ourselves as a city to provide a higher level of customer service and to provide a higher level of quality interaction, you know, at a number of different levels. And I think if we're getting the feedback that percentage of people are uncomfortable calling 911, that tells us we have to fix our response. We have to do things differently so that our goal should be that everybody feels comfortable calling 911. Our goal should be that every single person in the city whose taxes fund our activity feels comfortable calling 911, knowing that we're going to send an appropriate response. And I think that the recommendations here move us closer to that. I think that we're really making some headway. So I appreciate this framing. I appreciate the really positive opportunity in front of us to move this work forward. And I'm excited about both tracks, both the mental health response and the 311 reporting. So thank you for all of the work that's gone into this and for really establishing a framework for us to move forward. I think people are going to be very excited about this. One thing that I am wondering about is I think people are so excited about the mental health response that I think there's going to be a little bit of impatience with a pilot that only covers 2 shifts, with only putting 2 teams out. And so I'm interested in having us really look at how quickly do we think we can ramp up to covering the whole city and covering the whole city 24/7 in the mental health response. I understand that there are some practical reasons why it's a little bit easier to implement something if you're implementing it in a smaller scale so that you can work out the bugs. But I think it's really important too that for us to get good data, I don't think people are going to start treating 911 differently until they know that we have the citywide coverage and know that wherever they are in the city, they'll get this new response. And then I think people will start more reliably trying it. So my question is, I guess, how far can we push this? Because I really think that this is an exciting opportunity, and I'm hopeful that at some point in the next year, we could ramp up to a much bigger scale pilot.
Chair Cunningham, Councilmember Fletcher, this is Brian again. Thanks for your question. And the only thing that I can say to that question is that's what the performance and innovation team is here for, and all of our partners, to test this and make sure that we get it right. But that is literally a decision for the council to make. In our recommendations, we talked about how long it would take us as far as a timeline to implement what we've currently proposed. And I'm assuming it might take just a little bit more time if the decision that the council makes is to ramp this up more. But I think that is something, again, that we're willing to try if that's the direction that we get from the council. The considerations, again, would be time and then additional money because of what we are proposing at 2 teams. And if you wanted to ramp it up, cover more shifts and even more parts of the city more thoroughly, then of course those are some considerations that would need to be that you guys would have to deal with. However, if that's the direction that we get, then we can go back, rework numbers, have different conversations to expand it and get back to you with some more solid answers. But right now, the only thing we have for you is the pilot that we proposed. And Andrea Larson is on the line as well, and if she has some comments, my supervisor, that she would like to include, she can hop right into.
Chair Cunningham, Councilmember Fletcher. One other thing to keep in mind is that on the slides you'll see for our timeline we have planning, implementation, and analysis. And know that while we're giving some benchmarks for what to expect for those timing, it's not as though during implementation we're not sort of like regularly evaluating how things are going. So that time is not as distinct as it looks. In reality, during the pilot phase, we would regularly be checking in to see how things are going. And I think that opens an opportunity if we're able to figure things out quickly and things are going really well and the response is really positive. That's one path. If we're experiencing a lot of barriers, we're seeing there's technology that's needed, that would take us down a different path. So the process looks very distinct, but it's quite adaptable during the pilot itself.
That's great, thank you. And I know when you've presented previously, you've had some analysis around the volume of calls. If we were to take all of the calls that are proposed to be taken from the mental health teams and then all of the reporting calls, how many 911 calls that are currently being dispatched to MPD does this sort of take out of MPD's queue?
Chair Cunningham, Councilmember Fletcher. It's hard for us to be able to answer that at this point. I think we need to do some further analysis, and that will include the nature of the pilot, the design of the pilot, and also, I think we'll have to do some early testing to better understand that. So for example, we don't know today how many, we have the volume, we don't know how many times there are competing calls at the same time or whether they are spread out. We don't know whether a pilot of an alternative response in giving a different kind of and different level of service would take longer or be more efficient. And so at this stage, it's a little early for us to be able to answer that with high levels of confidence. But that's something that we both need to work on in planning for the pilot and in assessing the pilot itself.
That's great, thank you. I know there's other people waiting to jump in, so I'll stop there for now.
All right, thank you. I do want to take a quick step back because Nicole Wheeler was able to join us, and we want to make sure that we create space for community voice, given they have put so much time and energy into this work as well. So Gina, I want to pass it back over to you so that you can set up Nicole to be able to speak to this item.
Thank you, Committee Chair Cunningham. Yes, want to value Nicole's time for joining us here today, and I also know that she will do a much better job explaining that community component than I did. So her slide begins on slide number 34. So if we could go back there to allow Nicole to speak to that.
Hi, everyone. Can you hear me? Hopefully.
Yes, we can. Thank you.
Lovely. Thank you so much. I've been in the meeting. I really appreciate you making space. Committee Chair Cunningham and council members, my name is Nicole Weiler, and I've served as a volunteer community voice on this work group since the spring of 2019. My background is in crisis advocacy, so I was asked to speak with you about how the city can support proactive de-escalation skills. Are we going to go through slides again? I'm now on the phone.
Right now, it seems the tech team is getting that slide back up with the recommendation you were going to be speaking to. So yes, we have the slide up now of proactive de-escalation within community through education and training. So if you want to speak to that, that'd be great. Just let us know when you have the slide changed.
Thank you. Next slide, please. I know that Gina mentioned that the goal is multifaceted. So this pilot program really hopes to train leaders from the majority of our 83 Minneapolis neighborhoods so that they can de-escalate community issues. So Vice Chair Fletcher, what you were just saying about feeling like the timeline might be kind of long, this pilot might be something to consider in the meantime. It's designed to not only acknowledge but invest in existing leaders who've been tirelessly organizing this work for years, unpaid and under-supported by the city of Minneapolis. Community voices on this work group were really insistent that a contracted training group not be connected to or born from the Minneapolis Police Department or any other city departments. We'd like to see the content and delivery be created and delivered by folks outside the enterprise. A lot of trust has been lost here. So we want to see existing community leaders trained in both de-escalation and the supportive facilitation tools to bring this education into our communities, because far too often effective leaders are dismissed for not having the right types of certification or professional development. So it would behoove the council to create and invest in circumstances to bring those tools to the community rather than potentially continue to punish them for exercising alternatives that the city is only now willing to fund. A potential course would be QPR, which again, I think was mentioned as like the mental health version of CPR. It's an intervention tactic that identifies the crisis, interrupts it, and directs that person to care. And if QPR is paired with bystander intervention, then we'll build skills that further help our neighborhoods build community accountability and responsive public safety without unnecessary law enforcement. The pilot creates a microgrant program, which will distribute stipends to those existing community leaders based on current market wages for freelance trainers. The microgrants also contribute to funding for supplies and shared meals, building community, and each microgrant would support those community leaders to provide free, no-cost trainings in their area, whether that's a neighborhood organization, a faith-based group, or other gathering space. Next slide, please. In order to fully and equitably invest in this work, the budget's informed by preparation and delivery of the initial training, all its aspects, staff time, recruiting community leaders, and then the resulting microgrant program, which will extend the same contracted wage for each of the 3 following community trainings. The planning period involves community outreach, a nomination portal to identify and engage with a diverse set of existing community leaders, as well as the development and management of the microgrant program, and a process for contracting with a trusted non-enterprise facilitation group. Over the course of 4 to 6 months, existing leaders will be trained and supported to bring this education back to our communities. And as far as considerations go, it can be difficult to measure the impact of adding something in order to eliminate something else. So I would defer back to OPI staff who have already done an excellent job answering your questions on the considerations for this and other pilots. Thank you.
Thank you again, Nicole. So appreciate you being here, taking the time to be here today, as well as the service that you have provided the residents of our city. So thank you so much for doing that. Truly, truly appreciated. With that, we have Councilmember Gordon in queue.
Thank you very much, and I don't have to take a lot more time, but it's really exciting to see this work come forward. I will say that I've been meeting with lots of block clubs in my ward, talking to a lot of people, and this alternative response is something that really resonates with folks. I also will note that San Francisco recently unveiled a proposal that they're working on where the fire department and the health department in San Francisco are working together to create this fourth alternative response. I think it was Community United Against Police Brutality that just came forward recently with a booklet and I think a year of research that they did on this idea, and they are supporting an alternative mental health crisis response as well. I'm really hopeful that the county will be willing to partner with us on this so that we can do something with it. And I'll actually note that I think the alternative responses to reports and crimes that are property crimes through 311 and other departments is really promising, as well as the training of community members in this area. So I think you've given us a lot of really good information here. I think you're going to have trouble holding us back because we're going to be so excited and we just want to run with it. And I apologize if we get too bold and try to move too fast. But really, I think we can make a really big difference moving forward, and I'm really glad that the timing of this comes before our budget public hearings and those kinds of considerations, so we can take this into account and look at how at least next year we can have some of these initial pilots up and running.
Great, thank you so much. I'd like to just add my excitement. This is really, I think, an amazing example of process of how to be able to do, you have an idea, the policymakers say this is something we would like to see, and then just a really solid process of producing the outcomes. I'm a big nerd for that, and just want to make sure to take the time to say that OPI has done amazing work with thinking about inclusive design, human-centered design, also thinking about the budgetary implications, how it roll out, how it would be evaluated. I mean, really phenomenal work, team. So thank you. And I also want to make sure to say thank you to all of the community members who have participated in this work. This has been quite a bit of time coming. So thank you very much for investing time and energy to be of service to our city. So thank you so much for that. I have a question around next steps, and it's totally okay if this hasn't been quite figured out yet, but with the pilots, the pilots, and well, specifically we'll say with the pilots related to mental health response, do we have any idea of what the next steps look like in terms of how those pilots would roll out? Because Office of Performance and Innovation does not necessarily do mental health work, so I'm just curious about if there's been any clarity around what those next steps would look like.
Chair Cunningham, thanks for the question. The team does not have, are not mental health professionals, certainly, but we do have expertise in running and standing up pilots. And so, I think the way that this typically works when we take on projects like this is to do the work to figure out who would be involved, how they'd be involved, what the goals and metrics and hypotheses of the pilot would be, standing up partners, engaging the partners who are involved in actually running the pilot. And so, for example, we may not be the ones responsible for holding a contract if there's someone outside the city partnering with us. We would work with a department to do that. And so, but we would support them in that and support them in evaluating how things are going, et cetera. So that work would start by identifying our internal and external partners and the structure and goals, et cetera, for the pilot itself.
So thank you for that. So from your perspective, then these pilots would continue to primarily live in, shouldn't say continue, but this work, I guess I could say, would continue to live in the city coordinator's office?
Yeah, I think we're equipped to and prepared to support the pilots themselves. The work, we do need to rely on partners across the city to do the work itself. And so the details of that, I mean, we've been talking to departments, of course, as we've been heading into these recommendations, and would need to, once we know, which pilots we want to move forward with and to what scale, then we would start to have more serious conversations about what that would look like. But yeah, we are fully prepared to support these pilots next year.
Got it. Thank you. And that's both mental health and 311?
Yep.
Okay, great. Thank you for that information. Are there any other questions or comments from my colleagues? All right. And is there more to present related to this?
Chair Cunningham, yes, we have the implementation plan for 311, transferring those step report only calls, as well as an update on the work with the departments to evaluate potential responses to additional problem nature codes. Okay, well, let's go ahead and get that started, and I will check in with folks because we're running on hour 3 now. This was quite a robust meeting. We thought it would be, but we always need to maybe overestimate, is because we love to get into the details here. So I'll go ahead and let you all get started with this second part of the presentation. And just keep advancing a few more slides. Right here. Thank you.
All right. Good afternoon again, Councilmember Cunningham and council members. Today, I will be going over the implementation plan to transfer staff report only calls from 911 and MPD to 311. Next slide, please. In front of you, you see the table of contents. This is what we will be covering today in this update on where the implementation plan is and letting you all know how we're going to move forward. Next slide, please. So, in late August of 2020, the Budget Committee directed the Office of Performance and Innovation to work with 311 and appropriate city departments to develop an implementation plan to transfer staff report only calls and response to 311. Next slide, please. Since then, the Office of Performance and Innovation has been able to work with 311, 911, and MPD to develop a detailed implementation plan, which is now complete and currently underway. Now, I do want to give context on theft report only calls because it can very easily be mistaken with other calls such as burglaries and robberies. So, a theft report only call is where someone's property is taken without their knowledge or permission. The incident, for it to be a theft report only call, the incident should not be in progress. There is no suspect known to the caller. There is no evidence at the scene. The theft did not involve a residential break-in, because if it did, that would be a burglary. No firearms are involved, be that a firearm stolen or a firearm used in the robbery. No injuries involved or threat of force, because that would then be considered a robbery. The incident did not occur within the last 10 minutes. So when we say theft report only calls, we really mean those calls where, maybe you get to your car, you left your door open overnight, someone went in and took some things, or, You are sitting in a public space, you walk away, someone takes your AirPods or your iPhone, you don't know who did it, no evidence, and things like that. Situations where you're really just reporting the theft, either to report trends, or you need an insurance, or maybe you hope for some form of resolution, but you really don't have that many leads. It's those calls where you're just reporting. Next slide, please. Now, the performance and innovation team in this process, we were able to work with 311 911 MPD to develop the plan and manage and organize it. 311 911 MPD, they worked well with us to get us the information that we needed, and the plan is now complete. Next slide, please. In this process, we were able to create a new process, identify the major tasks and timeline and parties responsible for these tasks. We're also able to identify the support needed for a successful implementation. Next slide, please. In front of you is the new theft report only process. The major changes in this process are as follows. 911 will no longer dispatch MPD to take these theft report only calls. Instead, they would transfer these calls to 311 when they come in. I would like to note that the theft report only calls that are handled by 311 and MPD are treated both in the same way. So transferring these calls would really result in an increased call volume for 311, but it will also be freeing up MPD to do more important things. And next slide, please. In front of you, you will see the tasks that have been identified and timelines attached to them with the key personnel responsible. And if council members are interested in more detail, there is a document with more detail. Now, 301 has already begun the hiring process, and the goal is to begin training these new customer service agents by January. I would like to note that it takes 301 about 4 to 5 months to complete training. So this means they will not be able to completely transfer these calls until May of 2021. Next slide, please. And I know Councilmember Palmisano brought this up, but I did just want to touch it again. 301 does have limited access to PIMS currently, and 301 can access PIMS to fill out the report, but they cannot pull the report back up if the resident calls back. And to give residents this holistic experience, we do need 301 to have this access for them to be able to do thorough reporting. And we already touched accessibility reporting options and how we do hope to address these in-person reporting options with the fourth recommendation from the 911 MPD work group. And next steps are really just continuing the implementation plan that has started. With that, I have completed the presentation. Thank you all for your time, and if you have any questions, I am here. Thank you.
Great, thank you, Rania. Let's see, are there any questions or comments from my colleagues? All right, not seeing any. Thank you for that thorough implementation plan. Again, big process nerd, so much appreciate that addition. And I do believe that we are on the final portion here with the department problem nature code review. So I will turn it back over to you all. Thank you.
Chair Cunningham, committee members, Jonathan Williams Kenzel, program manager with the Office of Performance Innovation. Sorry, I didn't cut a light on. I thought I'd have more light than I have now, but it got dark timeline. But I'm gonna be brief. So can we skip 2 slides? One more. Actually, just one final one. Perfect. As you all may be aware, my director, Brian Smith, came to you all earlier this summer and gave the results of an initial survey that our office did with departments to determine what problem nature codes the enterprise could potentially directly respond to without or with little assistance from the Minneapolis Police Department. After further conversations, some work by my colleagues that you all saw on the previous slides, we were able to identify regulatory services as a potential partner that could potentially take on at most 10 problem nature codes for direct response, but with confidence 5 problem initial codes that can provide direct response with, and those 5 are parking problem, as you know, is being recommended as a pilot, animal bite, aggressive dog, animal call, and animal fight in conjunction with the Minneapolis Police Department. I would just like to address that in completing this review, regulatory services really focuses analysis on scope and risk, and as well as staffing, training, and job classification, and trying to make sure that they ensure the safety of their staff, which they're currently doing now, and will continue to do as they do this work. Next slide, please. So, with primary focus being on animal control calls that they can take on as soon as 2022, but if there is some directive from council and the committee, possibly as early as 2021 with additional vetting and resources. I just want to give you a little bit of detail about what that could potentially look like. So Minneapolis Animal Care Control responds to animal problem initial code calls 24 hours a day, 7 days a week. And they run regular operations Monday through Friday, 7:30 a.m. to 1 p.m. and one daily shift from 7:30 a.m. to 3 p.m. on the weekends. During the weekends and third shift, MACC relies on staff responding to on-call second shift on weekends and third shift 7 days a week. During on-call hours, staff responds to these call codes in partnership with the Minneapolis Police Department. When call codes come in, police respond immediately to the scene, and an MACC officer is dispatched from their home. Once an MACC officer arrives, police are relieved of the call. I would like to highlight that animal fight is a potential felony in nature, and so MAC responds in conjunction with the police department. With additional staffing and associated equipment to stand up a full shift, MACC could respond directly to the first 3 problem codes without additional support from the Minneapolis Police Department. Because MACC responds to overnight calls with police, having a full shift, including a supervisor, will provide backup and additional coverage to respond to overlapping or complicated calls and assist with keeping employees safe. Furthermore, MACC officers respond directly to overnight calls, increases public safety because the division has the equipment and training to handle animals. This would also improve time and MPD's capacity. Currently, responding to calls by MACC takes up to 60 to 90 minutes from call to arrival. And between that call and arrival time, the police department, as they arrive first, has to sit and wait for MAC to respond before they're relieved. If we need to provide any answers to additional questions, Kim Keller and I are here. Thank you for being patient with us, and we can answer any questions regards to problem initial codes and their responses. Just trying to make that brief for you all. So.
Thank you for doing so. I do want to make sure, though, that we have enough space because you all have done really good work. So do you feel like you were able to get through anything? Is there any additional information that you want to make sure that we know and the public knows?
The most important data, yes, or information, yes, is available. I was able to speak on. I have a lot of summary data. Just to highlight, we're potentially talking about 10% of problem nature codes, which is over 31,000 that were collected in 2019 as MPA incidents that regulatory services could potentially respond to with additional resources and additional information. So we're looking at a number of incidents that another department within our enterprise could potentially respond to.
Great, thank you. And to clarify for animal bite, is that any animal bite? So like even if it's someone's own pet that MPD responds to?
I would refer to Kim on that one just to make sure.
Director Keller, do you have any clarifying information on that? You still have her on the line? I see you're unmuted, but we can't hear you. Can we try again? We can sort of hear you, but you're very far away, it sounds like. Are other folks able to hear her? Because I'm not. Can we try?
I couldn't hear either.
Okay, it sounds like you're very far away, like you're talking across the room. So just if we could try to figure that out. We can also come back as you figure that out. Are there any other questions or comments from my colleagues related to this problem nature code update? Councilmember Fletcher.
Thank you, Chair Cunningham. I guess I'm just curious. So I appreciate this work, and I actually do think that some of this makes sense for us to look at, and it's a healthy chunk of calls. So I appreciate that we identified some real work that could transition and shift. I wonder if I guess I'm wondering from the coordinator's office what the status is of the other departments, because Reg Services looks like the only one that got us a report. So if we can just kind of check in on where other folks are and thinking about this, and then if we are able to get Director Keller able to communicate with us, I would love to hear her answer to the chair's question as well.
Councilmember Fletcher, Jonathan Williams Kenzel again. Our initial survey, we did survey all departments, and many of them gave thorough responses. As you know, examples are internal departments like HR, IT, could not potentially respond to those calls, so they're pretty easy to eliminate. And then there was a number of report-only calls that we had conversations in slides further up with my other colleagues that were going to be talked about being moved to 311 or having a non-police staff member actually address. So that cut down a significant amount of calls that could we respond to. And so we're really down to Public Works and Regulatory Services. And Public Works, just from our review, had the Regulatory Services, just from our review, had the capabilities in the scope to be able to handle this kind of scope of calls that we have left. But if asked and if directed by my boss and his supervisor as well, we can continue to engage some other departments again about some other problem nature codes.
Thank you.
Thank you for that. Director Keller, do we want to maybe try one more time to see if we're able to hear you this time?
Yes, I can certainly try one more time.
Hooray! We can hear you.
Lovely. Apologies for that. Council Chair Cunningham, thank you so much for the question. So during regular operational hours, MAC responds to the animal bite, aggressive dog, and animal calls all on its own. It does not need MPD to co-respond. Animal fight calls, because of the nature of the calls, there's always a co-response there. During on-call hours or our non-traditional operational hours, what happens is the call comes into 911 and an MPD officer is dispatched immediately. At the same time, an animal control officer is also dispatched, but they are coming from home. And so that is the delay in service. And unless if there's a true emergency happening, of course, the MPD will step in and handle that. But oftentimes, the immediate danger has passed, and the MPD officer, because they don't have the training and the equipment that we have, stand down and wait for us to arrive. They don't release the call though until we arrive, and so that's where there can be a delay of 60 to 90 minutes for the public to get the full service.
Got it. Thank you so much. And on that particular note, I just have to say that MACC officers provide amazing customer service. They are wonderful to work with. I have done a ride along with them. They've visited our house, and I mean, they're just amazing, and I'm so grateful for their service to the city. This is maybe for you, Director, maybe also for Jonathan. I'm curious, we passed a staff direction at the end of last year related to traffic enforcement. And so we have a work group here at the city that has gotten behind because of COVID and the uprising. So of course, like everything else, it got delayed. I'm curious around if there has been any conversation around traffic enforcement related work, and that also is a bit of a public works conversation in question, but just curious to hear where that fits in. And again, that could be for Director Keller or for Jonathan more broadly.
Chair Cunningham, we have been working through the guidance of the coordinator's office on the staff direction, so I will defer to you, Jonathan, or the team.
Thank you.
Councilmember Cunningham, Chair Cunningham, this is Brian again. I didn't know I was coming back on camera, so I'm in a t-shirt now. I apologize. Okay, that's a little better.
Forgiven.
Apologies. We, as a work group and as a team, we have been talking about other traffic incidents and responding to traffic incidents, but it takes a lot more detailed research because of, number one, and one of the things we always have to take into consideration for our city staff is personal safety. And when responding to different levels of traffic incidents, which could be coded very differently depending on what is actually happening at the scene, we just need to do more digging into what all of those types of calls are, the risk involved with them, current policies or legalities that we may have around certain calls and who can respond. And then we can give a more detailed report about what will be included. And so when Director Keller says that she is deferring to the coordinator's office and working with us on that, that's because there's so much more information that we need to give them so that they're prepared to respond to those questions, that it wouldn't, we just wouldn't feel comfortable having them do that without being thorough, so that she can really understand what she's taking on and the risk and what everything else that will be involved with that. So we will be able to get you some more information on that, but we just haven't gotten into it. I mean, we haven't gotten as much information about that as we'd like, but it should be coming soon.
Great. Thank you for that. And I want to close the loop. I mean, you all probably already talking, but I just want to make sure that I close the loop, that the traffic enforcement work group is being led up by Commander Gio Valiz, who is very committed to a non-law enforcement response, as well as Ethan Foley from Public Works. So I just want to make sure that as those conversations are happening, we're closing that loop. You may already be talking to them, but just wanted to bring that in. Great. Thank you so much for that. And are there any other questions or comments from my colleagues? All right, seeing none, I will direct the clerk to file that report. With that, I see no further business before the committee. Thank you everyone for sticking it out. It was a marathon meeting, but wonderful content, great work with Neighborhoods 2020, great work with the 911 MPD work group. These are years of them in the making, and so it's an honor to be able to hold space as we work through the next steps together. So thank you everyone, and all this work will be going before the full city council on Friday. Thanks everybody.